IHW Council, we believe that health is everyone's responsibility. As India's premier think tank for health advocacy, our work is closely aligned with the United Nations Sustainable Development Goals, championing a holistic vision of well-being based on good air, good food, good water, good living and healthcare for all. Over the years, the IHW Council has built a powerful platform where policymakers, healthcare leaders, communities, and innovators unite to drive meaningful change in public health, environmental health, and sustainable living. To give you a glimpse into our journey, we will begin with a short video. We request you all to kindly direct your attention towards the screen.
In a world where health defines potential, diseases become barriers to growth. Weaving dreams of a world without sickness and full of well-being, the Integrated Health and Well-being Council was born. At its core, the Council stands for the high five of health. Good air, good food, good water, good living, and good healthcare for everyone. Aligned with the United Nations Sustainable Development Goals, the Council firmly works towards making sure health reaches every corner of the world. IHW Council has built prestigious forums for holistic health discourse, like India Health and Wellness Summit and Awards, CSR Health Impact Awards, CME Excellence Movement, Ayushman Bharat Conclave, Jal Shakti Conclave, Digital Health Summit, Patient First Summit, the Good Air Movement and Summit, Rapid Global Cancer Alliance, and the She Alliance for Spirituality in Health and the Environment. These initiatives have received wholehearted support from policymakers, industry captains, community leaders, health experts, celebrities, and influencers. Respected brands and advocates have also joined the Council, becoming allies in the mission for a healthier world.
I think this wellness is an important initiative. I will definitely be interested to know the conclusions of your deliberations, and I'll definitely take these issues and your suggestions forward to the logical conclusion.
हेल्थ सर्विसेज कैसी होनी चाहिए, ये तो महत्वपूर्ण विषय है ही, पर उसके पहले हमको हॉस्पिटल या डॉक्टर के पास जाने की जरूरत न पड़े, इसके लिए हमारे एयर पोल्यूशन और वाटर पोल्यूशन को हम कैसे सुधारें, इस बात पर जोर देने की आवश्यकता है।
कहते हैं क्षिति जल पावक गगन समीरा, पंच तत्व निर्मित यह अदम शरीरा। ये पंच तत्वों से निर्मित यह शरीर पुनः पंच तत्व में ही मिल जाता है। तो हमें उन पंच तत्व का, जिससे इस शरीर की रचना हुई है, आकाश, पृथ्वी, अग्नि, वायु, जल, इन सबका ख्याल ही नहीं रखना, बल्कि इन पंच तत्वों का रक्षा करना हमारा पहला कर्तव्य हो जाता है।
In the digital world, the Council reaches millions with credible source of knowledge, empowering them to protect their health and prevent diseases. Through its various initiatives harnessing the power of social media, the Council impacts over 100 million lives annually. Join IHW Council in creating a world where limitless potential knows no bounds. Together, we can achieve a happier, healthier world for all.
That's the kind of commendable work that IHW Council is doing. Ladies and gentlemen, smart hospitals are not only about digitization, they are about building systems that are intelligent, adaptive, connected, and deeply patient-centric. This summit is also strategically aligned with the India AI Summit in partnership with the Ministry of Electronics and Information Technology, Government of India, and Digital India. Before we begin, I would like to extend a heartfelt thank you to our supporters, Paras Health, our gold partner. Can we please give it up for Paras Health? We also thank a Teamwork Communications Group for their wholehearted support. And let us now set the tone for today's summit with our next video. The video created a strong base for our discussions ahead. And now, ladies and gentlemen, it is my privilege to introduce a man who's at the helm, Mr. Kamal Narayan Omar, CEO of IHW Council and co-founder of Teamwork Communications Group. Mr. Omar is a distinguished communicator and passionate health advocate. Before leading IHW, he worked as a journalist for leading Indian media outlets like the Hindustan Times and the Press Trust of India. Over nearly 2 decades, he has harnessed the power of story and policy to advance public health, environmental justice, and sustainable development. He co-founded Teamwork Communications Group in 2009, which has grown into one of the India's leading health-focused communication consultancies. Under his leadership, IHW Council has become a force for integrated health advocacy, mobilizing policymakers, civil society, and communities around the big five of health, which is good air, food, water, lifestyle, and universal care. Please join me in extending a very warm welcome on stage to Mr. Kamal Narayan Omar for the opening remarks.
Thank you for this elaborate introduction. Good morning to all our distinguished guests, leaders from healthcare industry, technology, civil society, and the young professionals who are preparing to power the next wave of health digitization in our country. It is my privilege to welcome you to the second edition of Smart Hospitals and Diagnostics Summit, a platform that reflects IHW Council's core belief that health is both a personal right and a national priority and must be continuously strengthened through innovation, resources, and technology. At IHW Council, we always maintain that good health is not only the result of medical expertise, it is shaped by systems, policies, innovation, and a collective commitment to the dignity and well-being of every citizen. Our SDG-aligned work from national health campaigns to evidence-driven policy dialogues has taught us one important aspect, that modern healthcare challenges cannot be solved in silos. They demand shared purpose and shared responsibility. This philosophy shapes today's theme of our event. When we speak of smart hospital and smart diagnostics, we are not only celebrating technology for the sake of talking or celebrating technology. We are acknowledging a reality that digital transformation is now the central to closing gaps in access of healthcare, early diagnosis, continuity of care, and patient outcomes. India stands at a decisive moment. The rise of digital adoption, from Ayushman Bharat Digital Mission to the Abha IDs to telemedicine reaching remote communities, is building a stronger, more accurate, and accountable health backbone. These are not just administrative successes, but they are signs of a system preparing for the future. But as infrastructure expands, one question matters most to all of us. How do we ensure these endeavors and advances translate into better care, faster recovery, and stronger human outcomes for the healthcare? That is where smart hospitals and diagnostics become essential, enabling early detection, timely intervention, faster workflows, empowered clinicians, and informed patients, and more efficient use of limited resources. And we are a resource crunch country, and efficient resources, optimization or utilization of limited resources is the most critical aspect our healthcare has to deal every day. Ultimately, they help people return to healthier lives and safer and sooner way. For us at IHW Council, a truly smart health ecosystem narrows disparities and not widens them. It must bring the underserved closer to the quality care and not push them further away. As we inaugurate this summit, let us use this platform not only to showcase innovation but to reaffirm the values that must guide it. Let us explore how hospitals can evolve without losing the human touch, how diagnostics can become much smarter while staying accessible, and how digital health can remain rooted in compassion and fairness. Today, we bring together some of the finest minds across healthcare, diagnostics, technology, and policy, and let us build a healthcare system which is not only truly smart but really compassionate and accessible to all. So thank you so much all of you for being here with us today, and we look forward to an insightful day over the day, and also some discussions which can really help us pave the path for a really compassionate, accessible, integrated health system for all. Thank you.
Thank you very much, sir, for those insightful remarks. Ladies and gentlemen, we will now kickstart the first panel discussion for the day, which is on the theme Smart Hospitals, Rebuilding Health Systems Beyond the Four Walls. In this session, we'll explore how the next generation hospital infrastructure is being redefined through smart ICUs, connected OPDs, IoT integration, automated workflows, and intelligent patient navigation systems. The discussions will examine how hospitals can evolve into adaptive, data-driven ecosystems that deliver safer, faster, and more personalized care. And now it is my pleasure to invite our esteemed speakers on stage. Please join me in welcoming Dr. Kapil Garg on stage. Dr. Kapil Garg, Group Medical Director, Paras Health. Dr. Kapil Garg is a senior clinical leader driving quality systems, patient safety frameworks, and evidence-based operational excellence across Paras Health. His strategic direction has been central to strengthening integrated patient-centric hospital care. Can we please welcome Dr. Kapil Garg on stage? A very warm welcome to you, sir. Thank you very much for joining. We now welcome on stage Colonel Rajiv Manali, CEO, SUT Patom Super Specialty Hospital. Please put your hands together for Colonel Manali. An Army veteran turned healthcare leader, Colonel Rajiv Manali is known for transforming hospitals with discipline, operational rigor, and compassionate patient-centric systems. He is widely respected for reviving institutions through modern leadership. A very warm welcome to you, sir. We also have with us Mr. Deepak Sharma, co-founder and CEO, MedLearn. Mr. Deepak Sharma is a pioneer in digital healthcare learning, helping hospitals build future-ready workforces through technology-enabled training. His work is redefining continuous competency development in Indian hospitals. Can we please welcome Mr. Sharma on stage? We also have Dr. Sunil Dagar joining us on stage, COO Yashoda Hospitals. Dr. Sunil leads large-scale smart operations across Yashoda Hospitals with a strong focus on smart ICUs, digital OPDs, and measurable clinical efficiency. Please put your hands together and welcome Dr. Sunil Dagar. This session will be moderated by Mr. Kamal Narayan Omar, CEO, IHW Council, and I now hand over the session to esteemed session moderator for further proceedings.
Thank you so much. And I'm so honored to have such a esteemed and accomplished set of thought leaders and healthcare leaders of our country to ponder over something which is talk of the town and which is all of us are being told time and again that how the hospitals, the healthcare system is getting smarter for the patients, for the people. So I would like to further understand, and little decode, continuing from my opening remark also, that how, is it only about technology, or it is about, mixing technology or adding technology to that important compassionate human touch, which is required to really not only treat but to heal. So let me begin. I'll start with Dr. Kapil. And well, a basic question I would like to understand first. That Dr. Kapil, being, an important, I think it's working. Is it working? Okay. This one is working. Yeah.
Working now.
So, so you are leading an important healthcare brand, and you are helping set up new hospitals. All from brownfield to greenfield, all type of hospitals, and you have been not only at the side of hospital administration, but also at the side of the academia as well. So Dr. Garg, what is a smart hospital actually, and how do you see a smart hospital? Is it a hospital with lot of tech? We saw a lot of videos with technology all around. Is it that is the smart hospital, or it is something beyond that? It is that transformation with patient experience while getting healed and treated, and the caregiver's experience while they navigate a hospital. What is a smart hospital?
Thanks, Kamal. So it's really a pleasure to be here. So I thank Kamal and Nikki to invite me for this panel. So our association with the Kamal is a long back. So I think 11, 12 years now. So since then they are organizing and making this advocacy felt across the basically all part of the healthcare. And I really like that they have taken a holistic approach. So thanks a lot. So coming back to the main thing. So what's smart hospital? So all of you heard that basically famous anecdote from the 3 Idiots, the Rancho says, what's a machine? So anything which reduces the human effort, that's a machine. Right. So similar thing is that anything which reduces the effort and it makes the patient basically convenience, and the safer and the operational efficiency, that is it towards going to smartness of the hospital. So put to simple across, like anything which helps the reduces the basically error, brings the efficiencies. So these are basically all things which are constituent of the smart hospital. Yes, of course, like basically we need to adopt the technologies, but it's not a mere technology. It has to have the basically soft touch also along with the built in that. So we need to build the systems basically which integrates everything from the human effort to the technology, which enables them basically. So their productivity increases, the errors reduces, and of course, it's basically in the long run, it increases the profitability of the hospital also, because your productivity increases and all. So we need to basically plan it out. It's basically, it's not a one thing, okay, I want to be smart today itself and start working on it, buy the gadgets. No, I think it's the entire journey, which to very frank, if somebody starts today, so it will take 2-3 years time till we really reach to that level, where we can actually plan, okay, I'm building this department, so I know beforehand what are my inputs, what are the workflows, how much the peak load, how will handle the peak loads, what will the workflows, how will set up systems, all things can be planned. So that's what basically the virtual hospital, digital hospitals are coming into place. And I was just reading yesterday, like in Word, like 4-5 hospitals are all done there. Like one is the Israel, one is the Singapore hospital. They have really created a digital hospital. Now you can play and plug and play in that entire system, ecosystem, and can work out the whole the outcomes basically. So let's suppose if you want to plan, so they have done like all the data they have integrated. There are a lot of AIs and everything is there. So they created a complete virtual hospital within the system. So that kind of thing, it takes time, but yes, we need to start now. And this is the basically, it's not as anything which is a fancy, it's a need of the hour. And people who won't adopt will definitely be left out.
Interesting, and I liked your parallel which you gave from 3 Idiots, that anything, it's a very, whatever reduces the human effort is the machine. And I think whatever enhances the care outcome with, lesser or no, errors can be a smart healthcare also. Dr. Rajiv, since you are leading an, very I think I heard a lot about this hospital from you also, SUT Patam, and which is a leading hospital in South India. How you have been embedding smart technologies, and how you really perceive a hospital as a smart hospital, and what has been the journey towards achieving that, both in terms of not only having a faster access for the patients, was faster workflow, in terms of a better health outcome, but also can a smart hospital go beyond the four walls of the hospital also? Can it help people in prevention for, a better continuum of care post-hospital? How you are kind of integrating it?
Good morning, everyone, and thank you, Kamal, for this opportunity. I think you are setting a platform which initiates a lot of discussion. And smart hospital today, there's so much of literature, there's so much of discussion on what is a smart hospital. Now, I would like to define the smartness of the hospital from an entirely different angle. For me, technology is required, where required, and when required. Now, who decides whether a hospital is smart or not? Is profitability that decides the smartness of a hospital? Or is it all the technology that is being brought into the hospital decides the smartness of a hospital? I would like to see it from a patient's angle. A patient should decide as to which hospital is smart for him. Now, when you look at it from the patient's point of view, a hospital is smart when it has almost predictable outcomes. He is reasonably assured that he gets a cure. Secondly, he should also be reasonably assured that the hospital will not take him for a ride, will not fleece him as far as payments and the bills and the revenues are concerned. He also will consider a hospital smart when care is accessible and the entire staff, starting from the leadership of the hospital, clinicians, and the entire workforce, are empathetic and compassionate, and they all place patients in the center of everything that happens in the hospital. For a patient, that is a smart hospital. He couldn't be really bothered whether there are robots in the hospital to do surgery, or there's a clinician or a surgeon doing the surgery in the hospital. For him, that really does not matter. What matters to him is what is the outcome? How much does he have to pay to attain that outcome? And how is he being looked after in the hospital? I would say that a smart hospital is that where from the time a patient or all the patients enter to the way they are directed into the hospital, the way they are received in the hospital, the way they are allowed to do whatever they wish to do in the hospital without time delays and without cost being a major concern. And till the time he leaves the hospital, if he's cared for, if he's made to feel welcome, and if he feels at home, I think that is a smart hospital. So this technology adoption and all the other things that we talk about, data management, your digitalization of the hospital, AI being brought in and all that, it's all good. But that should not be the only concern to make a hospital smart. And that, I feel, really does not make a hospital smart. A hospital will only be smart when it cares for its patients and ensure that everything happens for the good of the patient. And there's a reasonable, the cost should not bother the patient to a great extent. That is my smart hospital. Thank you.
I think very beautifully explained, Dr. Rajiv. And I think this describes what should be the soul of hospital, whether it's smart or non-smart, but it should do the job which is needed. And you have very clearly identified that a smart hospital, the one which has the predictability and transparency, and most importantly, the empathy which can drive the right outcome. Dr. Dagar, you are at the helm of one of the the large setups in Delhi NCR, and I'm sure on way to become one of the most critical component to propel further our healthcare system, especially the private healthcare which we see today. How these elements which Dr. Rajiv has just described about what really defines a smart hospital, and I'm sure your brand Yashoda Hospital is definitely a smart hospital for that point of view. How you have or you are ensuring that these elements are well taken care of, and at the same time we are also able to render some broader services to the society in terms of taking preventive care to the people, to the communities around, not only the hospital, but beyond that also. So how you are taking that smart hospital narrative forward?
So thank you, Kamalji, for setting the tone, and I must congratulate you to taking up this subject of smart hospitals and diagnostics for the common public, because with this summit it goes out later on to the public to understand how the smart and AI-enabled hospitals looks like or how they function. And my senior colleagues have already introduced the philosophy behind it, that smart hospital is not just a infra or all machines or robots around making a hospital a smart hospital. Ultimately, it's the theme and how you plan, design the overall infrastructure, architecture, and the technology acquisition being synced to make a hospital a smart hospital. So I'll take this in a way, because since we have recently opened up our flagship hospital, and since it's a new one, so we have gone all around the world to understand one of the best practices in terms of patient care, technology, how data analytics and AI can be put together to make a hospital a smart hospital. So right from the architectural planning time, all these things related to IT, technology, equipments, all things have to be synced together so that your infrastructure, your processes, and as sir has said, the outcome actually which matters for the patient are being synced together so that it becomes a seamless experience for the patient, wherein the patient is being provided with the right care at the right time. So if these two things are not being matched and mapped together in sync, so with that you will not be able to actually make that hospital a smart hospital. And in that case, if you see it from the perspective of an individual patient journey in the hospital, be it in outpatient department or inpatient department, there are a lot of things which comes into account, like, for example, the EHR or the EMR, which is now at a level we have been seeing EMR or EHR for years, but now the time has come wherein conversational AI has taken up this thing, wherein just a conversation between a clinician and a patient can be transcribed into a meaningful prescription based on the guidelines or the standards of the reference nationally or internationally. At the same time, we enable them to serve the patients themselves who are capable enough to understand technology. When you have self-assistance kiosk, where again this conversational AI comes in picture, they just move to a kiosk and tell them in their language about their issues, and they are being guided to the right doctor at the right time, and they can they can, completely do all the registration and logging out and moving to the doctor, just skipping all the queues, be it at the billing, registration, or in the waiting area. So that also enhances the overall experience for a patient, And similarly, wherein we are able to, shorten the waiting times, the unnecessary handoffs which a patient goes through in the whole journey, wherein we have RFID or RTLS enabled tracking system, be it for patient or the equipments which are required in the overall patient care services. And last but not the least, it's always, it's for a smart hospital, it's all about how you, put the technology at the background in the playback, so that minimizes the stress for the patient, their attendants, and the clinicians and the staff which are working together for this overall patient care journey. So that's how we see it.
I think very, very interesting, and a couple of points you have touched about, that predictability on or skipping those queue. I think that is one of the major pain area. I'll come back to understand a little more about that, because one of the very integral part of any hospital experience is wait, and that many times it really agonize the whole experience and the people who are navigating it. But before that, let me go to Mr. Sarma. So when it comes to smart hospitals, gadgets, technologies, AI, conversational AI, robotics, and kiosk and all possible tech available. But all this tech has to be, I think, managed by human in some way as well, to drive the right kind of outcome. So do you see that, from smart hospitals or diagnostics point of view, the ideal outcome which we want, what it should be, and what is the role of skilling and skilled workforce to achieve that?
Thank you, Kamal. So I've been listening very carefully to all the leaders on the stage. It's, very interesting, the vision evolving, right, from diagnostics to patient flow. Obviously, efficiency is a big part of it. And specifically in India, I think we can take it for granted that there will never be enough doctors and nurses, never, right? So efficiency becomes very big if you can do more with less. Right. Either treat more people or make them more efficient, right? So either to pass on the cost or to, in some ways improve the profitability. But resource constraint is one thing it needs to solve. But finally, as you pointed out, the last mile of healthcare is care. And machines can't provide care, right? Caring for someone. So there is a Dr. Eric Topol is a cardiologist in US. He talks about AI, how it will impact. In the US, before this ambient technology came in, doctors are supposed to see a patient in 13 minutes. Think, do I look at this? Or do I talk to the patient, make eye contact, empathize, get better diagnosis? And some of that thing even makes a difference in the outcomes. Is a doctor being able to make eye contact, reassure, actually has a tangible. And that goes for nurses, that goes for everybody. So puts a different perspective on the workforce for a smart hospital. I think smart hospitals will need smarter workforces, right? And that smartness will come in, what we see, we work with over 100 hospitals in 4 different dimensions, right? One is the basic technology familiarity, right? Adopting technology. For example, we recently worked with a hospital that acquired another chain, and there are 3,000 new employees to be trained in 35 new applications. Unless those guys can use the applications, the smartness is not going to help, right? So rapidly being able to train people on actually using technology, right? The second part is actual clinical skills, right? Now there's lots of knowledge which comes in, how to use the knowledge coming out of the smarter diagnostic tools, etc. and that's going to keep changing. So to be able to rapidly upskill your workforce on the go, daily, right? The third, obviously, is empathy, soft skills, not just between, you know, say, patient and caregiver, but also between the teams, right? Because sometimes with a lot of reliance, things fall between cracks between two employees, so that all of these 3 or 4 dimensions of learning, right, which is digital skills, clinical skills, soft skills, right, interpersonal skills, all of them will need almost an ongoing emphasis on training and development, because the workforce is eventually going to make sure that the impact is felt in the last mile of care. And therefore the learning systems in smart also need to be agile, they need to be personalized, but they also need to be suitable for Indian standards. So we're working a lot towards developing those innovations, bringing in all different aspects of this so that your workforce can keep up. So you can get the mileage or the kind of benefits you've envisaged out of smart care. So this is really actually making a huge difference, what Dr. Sunil pointed out, right? If the doctor can just talk and have an ambient conversation and that gets into the ear automatically, then at a doctor level, the impact on the patient is X times.
Yeah,
right?
the doctor will have more time to interact with
Yeah.
the patient rather than,
Yeah.
kind of focusing on typing, which many times is quite slow.
Yeah, but that tells you that it is the human connection that makes such a big difference.
Right.
So that human connection needs to be there with nurses, with everybody who deals with patients, right? So the experience, even if you have to wait,
Yeah.
right, can be utilized. So I see that as a ongoing journey. I think it's just, my mantra is you're going to need smarter and smarter people, not dumber and dumber people.
Yeah, so smarter people are required to deliver smarter care in a smart hospital or a diagnostic setup.
And to keep them smart, you need to keep training.
Yeah, yeah. So that is skilling and upskilling is something, is a continuous process. So I think it's the first round was interesting to understand the, really decode what smart care should be. And all of you identified some very interesting aspect to it. So let me now take the second round of it and understand that if this is the objective, from where this starts, and does it starts from the designing itself? Does it starts from the planning itself? How you integrate all these aspects, including what even Mr. Sharma said about, ensuring that there is a sufficient focus about skilling, reskilling, upskilling on continuous basis. So you have a smart workforce working in a smart hospital. So again, let me go to Dr. Kapil. How do you, kind of embed all that and to also fill some of the major gaps which you as a clinician, you as a hospital administrator have seen over the period, and now you are seeing that hospitals of today are very efficiently able to plug those gaps or bridge those gaps?
Yeah. So what I'm saying, basically, it has to be the planned journey which we need to work it out. The very first important thing is that it has to come your vision, basically, the promoter's vision. Yes, I want to deliver. Then only thing will work. So that's what I'm saying. I take an example like our promoter, Dr. Nagar. Around 3 years back, he says, I'm going to budget this amount of budget for every hospital. In spite of you don't spend, and that budget was 10 times more which you used to spend. So that's basically the planning which we have done ahead. So the budget for the IT initiatives, it was 10 times more than what we used to have. So it's, I'm going to monitor how much you are going to spend, basically, that's the one. And to very frank, like till date, we are not able to spend that kind of budget which he has sanctioned that way. So that's the one aspect. Then we have to prepare the groundwork, basically. So basically, if you see, you have to train the people, you have to basically describe the entire process and also take them along, basically. So like if you really want to push anything, like just one go without groundwork being ready, like just for the basically this also. So the very basic foundation starts like here, everything has to be on the ERP, some system has to be built in. And so that the continuity of the information, and the whenever you want information, it should be available. So like it should not be basically a real-time information should be available. Then you have to support the staff basically and the consultants, like which are our doctors. Like so we build the there's an app for the consultants, there's an app for the basically patient, and there's an app for basically all the users, so that they can be real-time information. And good to us, like we are in the era where everybody has a mobile, so that access to information is immediate. So I'm thinking breaking the ground and taking the ground, basically building the ground from scratch is the basically the key. Then adopt gradual. Okay, like in our aspect, I'll say we started okay, in one go we can't do it. Let's start focusing OP. And we say OP EMR compliance has to be done. So we integrate that in everybody's mind, we have to do a complete OP EMR compliance. So I can glad to say that we are now almost 95% compliant in OP EMR records. And Srinagar, when we started, in the third month itself, we have 100% OP EMR. So that's the basically the thing, how you make the people ready. Now, then gradually going to the basically the IP side also, there also we say prioritize what is the more important. Of course, thing is that we should do all, but there should be gradual process. In that also we start, okay, let's start prioritizing the ER, prioritizing the cath lab, prioritizing the OT, and also which are the more critical things, where the many things are go wrong, and we require efficiency in those areas. And gradually we're coming to the ward level also, where we are now building on the basic infra, providing the entire Wi-Fi, have a computer on wheels, integrating the basically tablets available and everything. So all these things are gradually roll out. So I just take example, like if you see, take example of the phone itself, the mobile phone, which we call smartphone also, right? So it has actually the complete good example how we adopt the smartness. Like many of us, like which are the younger generation, they don't know when the earlier telephone, we used to wait years for the telephone connections. I remember in 92 or 93, we shifted in Faridabad. It took us 1 year to get a telephone connection, right? Yeah. That also, that time we have paid 15,000 rupees under own your telephone scheme, then only we could get in 1 year's time, right?
And that was only used for talking. Today's smartphone, people hardly talk and everything
absolutely,
is done in the
absolutely.
phone.
And I remember like I'm saying pain which my father used to have, basically, even the bill submission. They used to be in the line for 3 hours to submit the bill. And that time we used to wonder, why can't we pay in advance? Why can't we do something which can pay from the, so everything's now happening now, if you see. Now you can get a phone connection in maybe 15 minutes time, the SIM delivered at home, you can pay in advance, you can pay in the just go also, and from your own phone itself.
And with your phone you are doing almost everything.
Absolutely. So it has consumed your transistor, it has
your,
Walkmans, your camera,
theater.
everything has gone. So I'm saying that's the way basically. So, but if you see, that also was a gradual process. It didn't happen in day one. The very first thing which happened, okay, the digital phone come, analog phone came. Then we used to think, okay, why can't we have to go to pick a phone there? So then the cordless phone comes. Then the mobile phone came. Then it used to have only that, okay, we should know that I should be knowing who's calling me. Then the caller ID kind of thing concept came. Then the photographs came. So gradually it's adoption. The similar thing which I'm saying that, okay, that's the one which we have planned it out. And I think as I've said earlier, the typical journey is 2 through 3 years. But definitely, so there we have to prioritize where we want a more efficiency. As I mentioned that basically the pain point is that.
So the efficiency is being focused on the productivity and profitability side or the patient experience?
No, patient point of side. Like I tell you basically the very first interaction, what is there? The OP.
The first temptation can be towards productivity and
productivity. They could, to very frank, if at all the productivity would have been in mind, we would have not kept that kind of budget. Right? So we know in the long run it will pay. And we have to make the basically patient experience. So the reason I'm saying the why we OPMR, your OP footfall is 10, 12 times than the IP. And where the journey starts, that's the very first interaction. Right. So we have to make it very convenient process. And I tell you basically, even if you have to show some near dear ones to a hospital, you know you have to spend 1 day.
Yes.
Right. So that's in the back of your mind. You'll be losing one productive day of yours, and along with your some near dear ones, you have to go there, and you don't know. But if at all that productivity is there, your appointment is there, you've already paid for the test, and you can come back home in 2 hours' time, which is possible. Right. So that's the basically the what we call smartness. Absolutely. And secondly, other aspect which I like to also highlight, we don't have to do overdo. Now, that's the way in last week of our internal discussion, we had a discussion. Now appointment systems are coming in place. So what you do, you have appointment doctor, you have fixed appointment, go there, that time, come back in 1 hour's time. But that's good. But if you see, appointment slots of a good doctors are full for next 1 year. Or maybe 1 month. So why that person is deprived of that consultation of that particular person? So we remember when we were in medical college, we had a very famous doctor, Dr. Mittal, used to be orthopedic. But believe me, like everybody who wants to consult him in his OPD days is possible without any appointment system. So I'm saying gradually we have to think of that also. We should not be putting the bar ahead of the person who want to avail the services. So there should be mechanisms. So what we are thinking, we'll be keeping certain open slots where the people can come in. Okay, who can wait? Come and avail the services. So I'm saying it's not just do overdo. Think it from the patient point of view also. Keep the patient in mind. And I think if it all is not revolving around the patient's experience, it won't succeed. It will be definitely, has to be patient-centric approach, which will definitely protect efficiency and in the long run it will pay back, definitely.
That's an interesting point you mentioned about, the appointment system, and then, should people be deprived of, those consultations? And that is also, I think, a big area which, with the point which I mentioned earlier about wait or eternal wait is something which is a very important element, experience in all the hospital. Let me go to Dr. Rajiv. Dr. Rajiv, you talked about the experience. Dr. Kapil mentioned about the integration and how this is getting evolved, but you touched a very important part of that patient experience, whether it is from the predictability side, and all those are important aspects. Now, how, if I can understand a journey of a patient walking in to SUT Patam Hospital, what is that? Would you like to take us through that and show us that, okay, these are the points where there was normally you see a major challenge in terms of the gap of either care or efficiency, which you have plugged by ensuring that there is a very, very smooth experience and flow for the patient.
I'll start from the point where you mentioned in your introduction to the second phase of our discussion. How does planning help? Let's talk about planning. In a greenfield hospital, you can actually plan out for the maybe next 25, 30 years. It's quite likely that the visibility is there. But in a brownfield hospital, that is not there. You are starting from where you are and you have to make things work. So let us talk about making things work. Incidentally, I'm talking about my hospital, and it's the only hospital where it's a brownfield hospital. It is probably the only hospital in the world also which is located in a palace of erstwhile Travancore family, a royal family. Now, making a palace work as a hospital, the fancy of being royalty, coming into a palace and all that, leave that aside for the time being, converting it into a hospital with all the nuances that goes to make a hospital is a big challenge. Big challenge. But you have to do it because that's the situation which you have to deal with. So now how do you do it? I think it's extremely important to have a core team of leadership which involves every aspect of running a hospital, being involved in that, and everyone putting their heads together to set goals, firstly, and then ensure that those goals are actually implemented into action plans and action reviews also. Now, I feel the best way to ensure that everything goes fine is, doctor was talking about apps. You have the apps available, and also you can create groups using your WhatsApp. You don't actually even need an app. You have the WhatsApp available now, Arthra and all that. Use that, create groups within the hospital to actually see what is happening in the hospital. Like what we have done in our hospital is that there is a discharge and admission group. So that group is looking at everything that is happening, and if there's a problem, it is being reported immediately. So it's on real-time basis, this monitoring happens, and corrections are being done. Problems will be there. Definitely in a hospital, there will be problems, and there will be different sets of problems every day. But management of these problems is what really matters, and that is where these WhatsApp groups can help. Now, secondly, complaints group. To me, complaints was extremely important because infrastructure, like I was talking about being a palace, has got problems. The roof, it's, the way it is built is a problem. There could be insects, animals and all that on the, in the traditional Kerala style, there's a upper compartment which is open to keep the temperatures cool and all that. But that could also be habitat for various undesirable elements in the hospital. How do you keep them under control? Then your plumbing, electricity, everything is a problem, could be a problem. But how we manage it is we have got a complaints group. Anyone or everyone who wants to raise a complaint, there's a problem in a particular room, problem in a particular corridor, and maybe even in the premises there's a problem. It's all brought into this group. So this group is being monitored on a real-time basis. Therefore, and what happens is that, let's say hypothetically there's a plumbing problem. The person in charge for that, the maintenance engineer or the project engineer, has to report back in the group to say that what has been done. Firstly, has the complaint been noted? Secondly, has it been rectified? And then there is the score group which analyzes as to how much time has that been done in. So it is not that a complaint is registered in the morning and it's being cleared in the evening. No. So a real-time action also has to be reflected in the group. Now the third thing is that availability of rooms and all that you need to check. We had a big problem. Discharges are late because the doctors have their rounds late, announcements late, marking of the patient's discharge and all that. It used to take a lot of time. So once again, the group came into this, WhatsApp group came into action. It started pinpointing as to where are the delays. And those particular points, pain points, were addressed by the group. And ultimately, now we are able to manage a discharge within, let's say, about 4 to 5 hours of announcement of the discharge. That makes it much easier for the patient. At the center of everything is the patient. How convenient is his journey through the hospital, be it admission or discharge or whatever else, even OP for that matter.
So that's the interesting use of technology, and especially very easily available technology of WhatsApp to plug a lot of those gaps which you mentioned, and the other side of challenges which is related to the infrastructure, which is converting a palace into a hospital. I think I'm sure that you would be dealing on a day-to-day basis on a much more grander scale. Let me go to Dr. Dagar now. Dr. Dagar, you mentioned a couple of things that, related to appointment, and I want to just understand a patient's journey, how it is going to be in Yashoda Hospital or Yashoda Medicity, the new, the high-tech institution which has come up. And you mentioned about that even, the predictability of the timing and slots and all that. How it is can be, how you are ensuring that in your hospital, the patients are being informed on time? Is there a predictive analytics happening in terms of that how much time the doctor is spending with each patient and how much time in a queue? So are they being informed? How you are ensuring that this particular pain area, because it's really bothers many time patients to keep idling in the waiting lounges and keep hearing, and many time you even see that people lining up in the doctor's chamber, just trying to push in their way somehow, that because they are waiting for maybe 3 hours, and they are also seeing sometime that somebody who might have come in a much later time of the day is getting early access, maybe because of the VIP references and all that. The two happen. I also go sometime on a VIP reference. So how do you, you're going to ensure that these things are taken care of? Along with what are the other major gaps you are ensuring that Yashoda is going to, set new benchmarks on that?
Yeah. So Kamal, as Sir has started this subject, Dr. Garg, I will just add to it. Now in today's time, where we have access to a lot of, this smarter things, smartphones, apps. Not just apps. Now you have chatbots to interact. We have to understand and create options for our patients, because every patient is not same. Everybody has got their own abilities, accessibilities to these apps and the other resources and the mediums. So you have to create options. So this journey actually starts even before they come into the hospital for an appointment or so. So there are different mediums which you create, and you create options for different patients, how they can get into our system. So one thing is that it's been a conventional thing that where you create an information center, patient can call up that number and get an appointment done. Another thing, ERP based, you have a patient portal through your website where you have a mobile app of your website, and they get into that portal, they put in their UHID, they get the authentication done, and they register themselves for a particular doctor, a particular slot. But at the back of it, AI comes in, wherein you have AI-enabled predictability, wherein you are manage those slots for doctors. You have, even it can be day-based, it can be week-based, or it can monthly-based, or even you can see the seasonal patterns at in which season what kind of patient come more, or what would be the morbidity of such cases in that period. So that comes in picture, and that gives you, at the
Maybe
background.
like right now, a lot of respiratory patients might be coming.
As of now, if you see a lot of respiratory, neurological disorders, cardiac disorders comes up. So that's how you have that predictability, and you can modulate the time per patient the doctor is supposed to provide. And at the same time, you can have all these things managed, wherein you have, as Sir has said, that how you manage walk-ins. So you are able to know that this could be a predicted footfall for a day or for a week for this specialty and the doctor. Then you can manage those open slots at your end. You can manage your VIPs. India is a place of VIP culture.
Especially
Everybody,
Delhi.
yeah, especially in north of India and Delhi NCR, people love to feel special and a VIP. So these are certain things which you offer to your patient. And as I was talking about chatbot, it interacts with you. It actually enables you right from your appointment, sitting back in your office or at your home, and you walks in, and in not just hours, in minutes, you just goes in and goes out. But at the same time, we also have to understand that this quality comes with a cost. Yes. Right. And we have to make people understand this as well, that there are no free lunches, okay? So you have to at the same time make them aware and make them enabled to use these services. And another important thing, as I was saying, that the self-assistant kiosk, this is a wonderful thing which we have piloted at our space, wherein patient comes in, they just put in their UHID, and the first thing which happens is a service token which gets generated, which is unique for that particular day of that patient. So wherever the patient goes right at the consultation of the consultation by the clinician. This token number or the service number is being generated. It's displayed. You goes to your order and it's done. Then the same number gets displayed at your diagnostic counters and the pharmacy counters, and so on and so forth. And at the last, it also enables you to share your experience without going to anyone, just through your mobile.
Wonderful.
Thank
So you talked about that many of these convenience come with cost, and accessibility is one of the major agenda we talk about. But I'm sure that you would also be, and during the day also we will be discussing about that how you balance between the cost and then the access. Let me quickly go to Deepak and then we will be closing this session. Deepak ji, you talked about skilling, you talked about smarter people, providing smarter care. And for that, I think also among the workforce, doctors are a very important workforce for the, care work. And how easy and how difficult it is to really upskill doctor. However, doctors do get involved in a lot of CMEs where the medical upskilling is involved, but are they equally receptive to use technologies, which can increase the efficiency, which can increase the patient's experience, and overall also the overall outcome, because when they are using the right technologies, they will be able to help patients far better. So do you see a challenge in that, or it's good to do?
No, so interesting that you asked. So because over the last year, we conducted about 20 workshops in cities, maybe connected with at least 600 hospitals, from 50 bed to 500 bed. And we called in CEOs, doctors, leaders about digitization and the adoption of technology. It's called the Digital Health Masterclass. I think quite the foundation, Nat Health was involved. And I personally did most of those workshops. Right. And the biggest challenge to adoption is the clinician resistance, not because, as you pointed out, not because they are tech phobes, afraid of technology, because they care about it. Exactly this impact on the patient connect. Now, obviously, things will change. The ambient technology is still going to be expensive. But what we've seen is also culture and leadership. So if, say, for the medical director wants to make sure that, the clinical protocols are being followed, right? They can set an example, right? We learned about best practice change management, right? Saying, if you're not going to be able to sort of see if your standards of care or the standard protocols are being followed, then what good is having a standard, right? And you can't see it unless it's digitized, right? Part of it is change management, culture, leadership. Part of it also depends on the composition of the workforce, right? If you have your own employees versus consultants, you can drive more efficiency. But I think most of the time when we see clinicians, complaining, it's because a lot of the times the implementation is kind of wonky. You take an EMR, if you do a standard one, don't do enough due diligence beforehand and you have to fill useless fields, right? Then there will be frustration. I think you can reduce that with good change management. I think doctors need special focus, if need be, to have special training sessions at their time, right? You need to create maybe within that champions who will show the way. Yes. But eventually we are seeing the transition. In fact, even in digital training, you have to adapt. We have something called adaptive learning for resuscitation, right? Now, if somebody who's been doing resuscitation for years and years and years, you can't teach him the theory from ABC. So the adaptive learning tools will then quickly check the accuracy level and guide you to only the places you need. You can finish a 1-hour course in 15 minutes, right? So you have to value and respect the time, what they bring, and you also have to be able to, adapt to this, because in the end, that's where the care starts, if you get it wrong there. So I think change is happening, but because of all the reasons I mentioned, it has been one big
and I think the whole focus, on digitization from the government, from the industry, its long-term, usage and importance, all is encouraging doctors. However, in many times we also see that ambient technology has been used in a different way, where a senior consultant is sitting and talking to the patient, and 2 juniors are typing the prescription in the system. So that's also so that's also one example of the ambient, not AI, but I think human intelligence. So thank you so much, our esteemed guest, for today. And I think we set the right tone about balancing the smart technology with those the care paradigm and the care outcome, how it should be helping patients navigate a healthcare system in a more predictable, more transparent, and I think with a more empathetic experiences. And from design to skilling, all that has to kind of play in sync and in kind of in accordance to all other elements. So to generate this or to create this perfect smart experience in our today's healthcare. So thank you so much, all of you, for being with us here. Over to you.
Please put your hands together for our learned speakers. That was a stimulating discussion we just had. May I now request Mr. Omer to kindly felicitate our esteemed panelists. We'll first extend, can we please have the memento on stage? We'll first extend our gratitude to Dr. Kapil Garg to please step forward and request Mr. Omer to present a memento to Dr. Kapil Garg. Please kindly keep the applause going as we now thank our esteemed panelists for sharing their valuable insights with us. May I now invite Mr. Deepak Sharma to please step forward. Kindly keep the applause going as we now present the memento to Mr. Deepak Sharma. I now invite Dr. Sunil Dagar to please step forward. Dr. Sunil. Colonel Rajiv Manali, sir, to please step forward. I now request our esteemed panelists to please come together for a group photograph. Kindly come together for a group photograph.
Not this one, come please, sir. If not this city program, then maybe. Which one? Oh, wow. So Jodhpur one is the palace? You all know now that Mahatma Gandhi suggested that the president house should be converted into a hospital. At that time, Viceroy.
Thank you very much for joining us for the first panel discussion. Thank you once again. Ladies and gentlemen, now a very special moment awaits us. And now, ladies and gentlemen, a very special moment wherein we'll extend a special recognition to Colonel Rajiv Manali. May I request Colonel Rajiv Manali and Mr. Kamal Narayan Omer to kindly join me on stage, wherein we'll be extending a special recognition to Colonel Rajiv Manali for his exemplary contribution to India's healthcare ecosystem. A distinguished army veteran and a transformational hospital leader, Colonel Manali has been instrumental in strengthening clinical governance, building disciplined patient-first hospital system, and reviving institutions through operational rigor and compassionate leadership. Can we all please put our hands together for Colonel Rajiv Manali? Thank you very much.
I'm extremely grateful to have received this honor from IHW. the last time I was with IHW Council, I think that was about 2 years back, I realized that they are doing excellent work, especially keeping the common man at heart, understanding his problems in various areas, including we heard about that air pollution, how to improve the quality of air and things like that. So there's a plethora of activities IHW Council is involved in, which actually takes care of the well-being and the health of the common man. I think that is something remarkable. The upper class, the elite, the whole world is there to look after them. When it comes to the common man, it is either the government or NGOs like this which take the initiative and get things done to the extent possible. India, huge country with the population that we have, we need more such groups, more such people to come up and do things to assist the government, to make things easier for the common man to survive in this big country of ours where the inequity is also quite large. And that is where the relevance of groups like and NGOs like IHW are extremely relevant. I'm glad that I'm here, and I had mentioned to Mr. Kamal the last time I was here that we look forward to being in touch, doing things together for the common man. Thank you very much.
Thank you very much, sir. Ladies and gentlemen, we'll now take a 15 minutes tea break. We request you to kindly proceed for the same. The arrangements are being made outside the hall in the pre-function area. Kindly reassemble in this hall at sharp 12:30 p.m. for the next panel discussion. Thank you very much. Enjoy your tea.
Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India.
Ladies and gentlemen, I will begin the panel discussion in next 2 minutes. We request all to kindly be seated and help us begin the session in time. You may also inform your colleagues who are outside the hall that we are starting very shortly. Kindly be seated and please switch your phones to silent mode. Welcome back, ladies and gentlemen. After a refreshing tea break, let's begin our next panel discussion on the theme Smart Diagnostics, Precision at Scale. This session highlights how cutting-edge technologies, including AI-powered imaging, molecular diagnostics, predictive analytics, liquid biopsies, automation, and cloud-enabled pathology are transforming diagnostic accuracy, speed, and accessibility. The panel will explore how digitization is enabling precision diagnostics to reach rural, remote, and resource-limited settings, ensuring early detection and better clinical outcomes across India. Please join me in welcoming our esteemed panelists on stage. We have with us Anu Kundra, SVP Lab Operations, Agilus Diagnostics. Can we all please welcome Ms. Kundra on stage with an energetic round of applause. We just had tea. I think we can do a little better. A leader in scaling precision diagnostics with quality, automation, and high reliability. A very warm welcome to you, ma'am. Thank you very much for joining us. Please welcome Ms. Shelly Mahajan, Lab Director and Clinical Lead Genomics, Mahajan Imaging. Kindly keep the applause going as we now welcome Ms. Shelly Mahajan, a genomics expert advancing early detection and personalized medicine. A very warm welcome to you. We also have with us Dr. Akar Kapoor, founder and partner, City Imaging and Clinical Labs, an innovator in digital imaging, automation, and patient-centric diagnostics. Please put your hands together and welcome Dr. Akar Kapoor. A very warm welcome to you, sir. Now let's welcome Dr. D.K. Gupta on stage, CMD Felix Healthcare, a healthcare innovator building a technology-driven patient-first hospital ecosystem. A very warm and hearty welcome to you, sir. And ladies and gentlemen, this session will be moderated by Ms. Urvashi Prasad, public policy expert and former director, Niti Aayog. Can we extend a very warm welcome to Ms. Urvashi Prasad. Ms. Prasad is a leading public policy professional who has played a pivotal role in shaping India's national health and development agenda. During her tenure as director at Niti Aayog, she contributed to major policy frameworks including health system strengthening, nutrition, digital health, and social sector reforms. Let's once again welcome all our esteemed and distinguished panelists on stage. A very warm welcome and thank you very much for joining us. I now hand over the session to esteemed session moderator, Ms. Urvashi Prasad, for further proceedings.
Thank you so much. And pleasure to be here with this very esteemed panel. Before I go to our panel, I'll just start with maybe a very short story. I'll try to keep it short. But it's taking back to say 3 years when, this is a personal story, but I was absolutely fit and fine, but one day, I started having symptoms and they were mostly infection. It looked like an infection, a stomach infection, intestinal issue or liver issue. And then, I'm really fast forwarding the story, but I went through a series of, sort of diagnostics and scans. And then finally, it sort of came to when I had my biopsy after my PET scan, where, my family was told, I was not told, because I was not, in that condition to process that. But I was, they were told that I possibly had something like a stomach carcinoma, and I had only 6 months to live. This is in 2022. And then it was just fortuitous, I would say. It was a stroke of luck that my tissue sample ended up in Dr. Anita Borges' laboratory. She's one of the most renowned oncopathologists. For those who don't know, she unfortunately passed away not so long ago. And it was somebody in her laboratory who said, listen, this has got nothing to do with stomach carcinoma. This is an adenocarcinoma in a relatively young person who's a non-smoker. Let's test for ALK. And that's how I was diagnosed with ALK-positive lung cancer. And of course, the whole treatment, everything dramatically changed from 6 months prognosis to I'm still sitting here in front of you. And the point of telling this story is that if somebody like me can go through these trials and tribulations, and I consider myself from a place of relative privilege in the national capital, how do we really make, yes, we have a lot of these advanced, sophisticated diagnostics now available to us, but how do we make it a norm and not an exception or not a rarity in terms of access, in terms of affordability? How do we really bring down this margin for error? How do we remove or minimize, we can never remove, but minimize the luck factor, which I think in my case was a huge factor. Otherwise, I don't know, where one would have headed. So I think those are some of the broader questions that, I would love to address through our distinguished panel. They come with a lot of experience, different vantage points in this space, and each of them will share that. But I had requested them that, if we could touch upon these aspects of how do we integrate these diagnostics that we're talking about, or these cutting edge technologies into our health system more seamlessly, and also how we bring it to scale, how we address the access and affordability issues for large parts of India. So I think if, you know, I can request each of you in your responses to sort of touch upon these issues as well, I think that'll be great. So maybe I'll start with Dr. Shelley, because, you know, we know each other very well, so it feels like a good place to start. But I think, Dr. Shelley, if you can share from your point of view how you've seen this space evolve, and how you've seen the new age diagnostics, you know, begin to transform. I, of course, have a lot of oncology bias, and I know a lot of the aspects in that, whether it's the next generation sequencing or various things, but feel free to talk about, you know, other areas as well. So over to you.
Yeah, so thanks, Dr. Urvashi, and thanks to everyone here for having us. So it being a smart diagnostics and advanced diagnostics era, I would say, what do you mean by smart diagnostics? Something to be smart, it has to be quick, it has to be accurate, accessible, and affordable. So, like Dr. Urvashi said, even though smart diagnostics today is very, very important and is being used and is being evolved in all the aspects of healthcare, but particularly in oncology, I would say it has reached a very, for lack of a better word, a very genuinely exciting time because of, you know, we just heard her story, and there are, of course, similar stories that we see, and that has made NGS and advanced diagnostics a breakthrough, a life-changing moment for a lot of people. So when it comes to advanced diagnostics today, I would say we are reaching a stage of multimodal diagnostics, wherein we need to have good imaging, we need to have good genomics, digital pathology, and a phenotypic data, which you know, which makes a complete story and gives us a complete picture of any diagnosis. And if we talk about oncology specifically, we are looking at early detection, we are looking at better case profiling, we are looking at better prognosis and good treatment recommendations. So if we just break it down a little, when we talk about radiomics or radiogenomics, here we are, for example, trying to link the radiology and imaging findings with mutations, and which is happening today. It may not be happening in our city, it may not be that actively happening in our country, but it is happening, and it is definitely changing how you know, making it basically non-invasive technique to identify and subtype, molecularly subtype a tumor without actually maybe doing a biopsy every time. Then secondly comes liquid biopsy, again a game changer. Not a very rare thing today. Liquid biopsy is basically, you know, we are doing a blood test and we are finding out mutations in a tumor, wherein we can in fact predict or you know, detect a cancer much before it is visible in radiology. Then comes again a non-invasive technique to make the diagnosis early, which is a very important part of smart diagnostics. Then thirdly, I would say computational pathology, which also is called digital pathology, wherein we are, so there are ways to backtrack gene expression to tumor microenvironment. Immune infiltration around the tumor, stromal reactions, etc., which help in identifying possible treatment options. Now, all of this together, combined with an additional layer of AI, which helps combining all this data, which is not humanly possible to do to be done by one person. So all of this combined with involvement of AI, I think it's changing the expectations we have from diagnostics today. There is lesser scope of error. There are more expectations of being accurate. There are more expectations of providing a clinically relevant answer to the patient. So I think, yes, of course, we are facing a lot of challenges. It's not very widely accepted today, and there are a lot of gaps which need to be filled. And I'm sure I would love to discuss those also. Yeah, for now, I think we are entering and we are in a very exciting diagnostic era, and I hope that we are able to adopt it even more.
Thank you, Dr. Shelley, and I think that sets a very nice context, for what we're discussing here. We'll, of course, like you said, we'll come back towards the end to see what we really need to be doing, even from a government point of view, policy point of view, private sector, etc., to really make this a norm, like I said, for all of us, and not so much of an exception. I'll take this to Dr. Anu next, and she has a lot of expertise in AI, use of AI in histopathology and cytology and various other areas, precision diagnostics, predictive diagnostics. So I'll really request your thoughts on how do you see we have really evolved, and where do you think we need to go from here?
Yeah. Good afternoon, and thank you for inviting me here to speak on this platform. And I would say that AI has come a long way, because back in 2021, we at that time it was SRL, and we started doing a project with Microsoft, and that was the first exposure what we got with the AI. So back that time, as I was attending the previous discussions and related to AI and the people's perception towards AI, so there was lots of barrier. People were like thinking, and even the doctors were thinking, is AI going to take away our jobs? Is AI replacing doctors? So that kind of perception was there. So for us also, it was a very new learning. We didn't know what is machine learning. We didn't know how to do the annotations, how to bring the data together. So these kind of changes, you really need adaptability. So you have to go back and actually learn that how I can adapt myself to these new things coming up, and that is the time the digital pathology was introduced in our system. So it was like people were reporting, so all these whole slide imagings were done, and then they were distributed to all of us, and we were giving, for each slide, we were giving 100 annotations. So we were actually teaching the computer. So it is not that AI is something which doctors are not going to be involved. We are going to be. But then that is giving us a platform where we can actually, differentiate between a normal and an abnormal. So I don't have to waste my time on screening those normal slides, whereas I can spend my better time, quality time, on screening the abnormal slides, atypical ones, or the borderline cases. And then that digital platform gave us the actually to get an opinion from the other doctor. If I wanted an expert opinion, so I had the whole slide imaging, and I can just send it to the other doctor, and they can actually remotely also, they can have a look, and we can discuss the slides. So that kind of innovations have been happening from a long time, and it is coming slowly up. India is also growing slowly, but again, as Dr. Shelley was telling, there is lots of, challenges are there. There are lots of connectivity issues are there. There are lots of government and PPP models are required, because everything comes with its own challenges. And then obviously other doctors which are in the peripheral areas, rural areas, they have to be also trained to that. So that brings us to the conclusion that actually it is bringing the smart health to the everybody's platform. So now everybody can access, but then again, it is the affordability. As now if you see, as you were talking about your case, So NGS, how many people are aware about NGS? How many clinicians are, but now even the oncologists, they are totally into the NGS based because they are looking for target therapies, they are looking for precision diagnosis. In fact, they're looking for that how, like if we are doing MRD, if you see. So even minimal residual disease after ALL and other things, it helps us, to diagnose whether there is going to be a relapse, whether the patient is in remission, how it is going to help us. So these kind of things are there. It's not that it is not there in India. Everything is available, but again, it is how much the awareness is there, how much the patients can afford it, and again, it is how much they are ready to adapt to that. So they are there, and again, there are multiple challenges. Patients, they still have that fear because the awareness is not there. So what happens is that they said, "Ye hamare par try karenge." Are they going to put us on trial? So to get to that, accepting for that precision, personalized and predictive, they have to participate in those programs. So that makes it a difference. So that is, I think, is very, very important. And again, we are doing a lots of digital platform at multiple stages for our workflows, our apps, where it is everybody has the connectivity, everybody has the AI generated, in fact, reporting systems where it is in multiple platforms it is there. But it's a robust system, again. And again, previously said, it again comes with challenges because everything comes very expensive.
Yeah.
So I think with time, everybody will change.
Yeah, thank you. And in fact, like you said, now as I see oncology treatment, at least in our major cities, major treatment centers, certainly I think all this has become, a norm in a way. To even if somebody has a progression of their cancer, for instance, we always say, do the NGS, do a repeat biopsy. Blood biopsies I know are being used for monitoring the disease as well, because you can't always do invasive things. But I think, our challenge with India always is that it cannot just be a limited major centers or cities. We need to get it across the country. And like you said, even educating the workforce and I think educating patients and caregivers. Like we have all these new terminologies which have now come in, and believe me, patients are so confused. I get reports every day from patients saying, now what does this mean? Like, what is this? So not everybody can understand, right, that what you're trying to do with your NGS and your blood biopsies. And so there's a lot of education that needs to also go on, that, this is what it is, this is how you interpret it. And I think somewhere we need to do that because, oncologists often lack the time.
Exactly.
That's a very simple thing,
Yes.
Ideally they can and they should be perhaps explaining all those things, but reality is they often lack the time. There's only
exactly.
2,000 of them who are registered in the country as of now, and the ones who people tend to go to would be probably even a much smaller subset of that. So I think we need a much broader education effort, which we cannot leave just to an oncologist or the treating person, but I think as a health system, as well as for people, for patients, like suddenly this new terminology comes into your life. I'm very comfortable with it now because I'm doing it for 3.5 years. But before that, for me also, it was if you just suddenly threw these words at me of NGS and, this and that and Guardant, and I was like, what is this? So I can only imagine the poor person out there who's clueless. So I think that's where we need to reach, right? That's the gap we need to fill, which is huge. Yeah. So thank you so much. And I'll now move on to Dr. Akar. He's a clinician entrepreneur. And I think if I can bring this question to you, that how do our labs, how do our diagnostic systems really balance all of this with the cost, with the affordability for the patient? How do we find that balance in our present very heterogeneous kind of health system and very complex, scenario. So your thoughts on that?
So I am a radiologist, and we have our own diagnostic center chains across Delhi NCR, and it's exciting times ahead, as well as we need to act responsibly for the patients. So the first point that ma'am you just discussed, that we all need to be well educated as well amongst us as medical fraternity, so that we use these advanced tests very judiciously for the patients. So it should be risk-based precision diagnostics rather than technology-based precision diagnostics. Those who are at high risks, in whom the management will actually change by using those investigations, be it imaging, be it molecular testing, NGS, in only those patients, these advanced tests should be used. That is the first point. Secondly, if I talk from a radiologist point of view, I'll give you insights into that. The first and foremost requirement is for the entire data of the patient to be well structured. All the previous records, be it imaging, be it the blood parameters, this should be structured under one roof, where the RIS, where the PACS, as well as the EMRs, they all can be interfaced. And there is not requirement for repeat testing again and again for the patients, because a lot of data is available in the recently done tests as well. And if we apply AI to that, we can actually extract deeper insights from these investigations. So that is one. And apart from that, all prior history, detailed history should also be available, which includes the patient family history, all the risk factors, which is very important. Another point which I want to highlight is, whenever we undergo these tests for the patients, we should go in for bundled testing, so that a more number of tests can be done clubbed at once. For example, ma'am, if anybody undergoes, a basic example, if anybody undergoes a KFT or an LFT, that would be priced at a higher amount versus if a patient undergoes a complete blood check. Even if I talk about the MRI, a patient undergoes a complete full body MRI at a center might be around 24, 25 or 30,000. A single MRI of one part would be around 7 to 8,000. So if we undergo these bundled testing at once, the blood could be withdrawn and these tests could be administered and told at once. That would also help in reducing the overall cost for the patients as well. So I feel that there has to be a multidisciplinary approach where people from different domains can actually act together for the benefit of the patients. Before ordering these tests, there is definitely a requirement, and these are exciting times ahead, because India is like one of the capitals in the world, since NCTs are growing at a rapid pace. Thus, this topic is of extreme relevance in today's time. Thank you.
Thank you so much. I think cost optimization, like you've discussed certain strategies. I think that's so important in our scenario where, a lot of things are still being paid for by patients out of pocket, unfortunately, because government schemes either don't cover them because, they're not included in the packages, and private insurance penetration is still, not as much as it could be. So I think in this scenario, these strategies of bundling and, other approaches can be very helpful. Thank you for that. I'll move on to Dr. Gupta now to share his thoughts, also more from a hospital perspective, how we're really integrating these diagnostics and trying to make treatment decisions more and more for patients based on some of these approaches which have come in. So over to you, Dr. Gupta.
Thank you, Dr. Oversee, and thank you, IHW. I think I am only odd one out in this panel. I am from hospital sector, and all of them are from diagnostic, and one is from having a lot of experience, policy makers, but with Niti Aayog and all. So being a hospital owner, and every hospital is highly dependent upon its diagnostic services, being it in-house or outsourced. If we want to give better outcome, better results, better patient care, better patient experience, and directly they are linked to your top line, bottom line, EBITDA, everything, your expansion also. Then their diagnostic services should be very highly quality oriented, and they should be highly precise also. Our objective in hospital is safe and quality treatment, so that we can have better outcome. And it highly depends on how we make our diagnosis of the patients. If diagnosis is accurate, 100% accurate, then treatment will be very targeted and results will be quite better. And for targeted treatment, you need precision diagnostics. Like we all know, machine learning has been used in diagnostics and labs for lots of time. But now it was CBC, that TLC can be high maybe because of lots of reasons. CRP may be high because of lots of reasons. This is not actually precise diagnostics. So doctors give medicines, antibiotics and other support medicines so that patients can be cured, and they actually do in अंधेरे में तीर लगाना ऐसे होता है करना, and it has lots of side effects, poor prognosis, poor outcome, complications, even death sometimes. So if doctors want to be empowered, then our diagnostic support should be very highly precise. They should be targeted, genome based, at cellular level, genes level. If we have that precision in our diagnostic, that we can diagnose at molecular level of a patient, that what the gene level mutation there, or there is some sequencing there, or maybe cellular level there is something abnormal. And if it is diagnosed, and if we have such product that these abnormalities can be managed through our medicines, then this is actually targeted therapy, target approach, without any side effects, without any complications, very fast recovery, better prognosis, better outcome. And I think this is the best we can think right now in terms of AI, in terms of digitalization, in terms of precision diagnostic, 3D printing, like robotics, AR, VR. If we all combine all these systems and processes under one roof in a diagnostic setup, then we can provide definitely this set of predictive diagnosis, preventive diagnosis, and curative and palliative care also. With such instruments, equipments, technology, if we have, then we can diagnose, we can predict like high-risk patients, high-profile patients for some special disease or special lifestyle disease, and it can be cured without it is happening to our body. But this is the best part. And we are investing very little on predictive and preventive care right now. Our Indian healthcare budget also, Government of India budget is also, more than 95% is allocated to curative, or less than 5% is for wellness centers or preventive medicines. And that is also in last 10 years only. Before that it was around 100% for curative treatment only. If you go to best, there is 60% budget is allocation is for the curative treatment and 40% is for the preventive. We go one step ahead of it, we work on predictive medicine, then preventive. We all know prevention is better than cure, but prediction is better than prevention also. So with precision diagnostic, we can screen a lot of people. We can know what is the epidemiology there, what is disease they are happening there in that race, that geography, that location, that sex, age group, and we can give mass treatment to these populations. And we can reduce morbidity, mortality, and workload on our healthcare infrastructure also. If we predict, then we will reduce prevention. If we prevention, we will reduce disability and morbidity. And if we do early diagnosis and prompt diagnosis and effective treatment, we reduce disability, complication, and death. So this is actually, if you talk in the marketing side, this is a sales funnel actually. Prediction, prevention, treatment, outcome. अगर आप सारे funnels पे काम कर लें, we can like it can reduce bottleneck at each step, then definitely outcome can be better. So from doctor's point of view, hospital point of view, we are highly dependent, and definitely currently whatever is available in precision diagnosis is quite expensive. Less than 1% population can afford it, because this is not covered under government insurance, not on Aisman, private insurance, OPD we cannot afford. As Dr. Urvashi said, she said out-of-pocket expenses. Around 10 years back, we were spending around 63% out-of-pocket expenses by selling our houses, taking loans, selling jewelries and all. Currently, it is around 43%, despite having 50 crore of population is covered by Aisman. Because Aisman don't cover this OPD treatment and OPD diagnostics also. So I think there should be bigger government policy. I think policymakers should think over it. They should align with our team members, so that the budget allocation can be high, and all the government schemes and private schemes, all the healthcare insurance should be covered for the primary care, for the diagnostic care, even radiology, medicine, everything should be covered, because we are giving them like half cover, less than half cover. Mostly, if you prevent early, you can reduce the treatment cost also, and it can reduce the burden on the private insurance players also and government insurance players also. So I think primary healthcare services should be worked upon, especially focusing on the early diagnosis and early treatment and effective treatment. Thank you so much.
Thank you so much, Dr. Gupta. And you've, I think, already started to give us some very important policy suggestions as well. I think something that many of us in the space have been pushing for, that we need to look at the whole outpatient space, because actually the success of a health system is how many people you can keep out of hospitals. And if your hospital beds are not overflowing, then you probably have a very successful health system. So that mindset, like you said, is maybe slowly shown some signs of changing, but still a long way to go. We're still very cure-focused, hospital-focused, and actually it should be completely the other way around, especially for a population of our scale and diversity, complexity. If everybody is going to keep landing up in hospitals, any health system in the world will just collapse. So I think that we still need to make more inroads, into that mindset, and also the budgets, as you said, shift them more towards preventive, primary, and also I think diagnostics. You made this important point that something like an NGS today, it can completely change, and I think I am an example of that. That's why I shared my story, that from stomach carcinoma, 6 months to live, I went to a completely different scenario, and I think it was in my case a stroke of luck, but how many people get that luck, or how many people get that chance? So it can really make a world of a difference, and therefore NGS, or whatever these technologies which are getting us to exactly what the patient has, how do you tailor the treatment to them, will not only dramatically improve outcomes for the patient, but also tolerability. Like you said, if we can give a targeted therapy instead of a very toxic chemotherapy, then that aspect gets hugely addressed. And also I think we should look at it from a health expenditure point of view. We probably spend more when we are like going all over the place trying to make the right diagnosis, as opposed to if we could quickly arrive at the right diagnosis, we might actually spend less and get more outcomes for that. So I think a lot of important points, a lot of policy suggestions, which is where I want to go to the panel for this last round, and then I'll open up for some questions. So Dr. Shelley, we'll start again with you. What do you think, the government policy point of view should be, and also anything that you think the private sector can be doing differently or better or more of? So your thoughts on that?
Yeah, so for that, I think it's important to first identify the gaps which are there. Like I said, the technology is there, but their adaptability is not there. Adoptability is not there because of so many gaps. First and foremost, like you said, we are still living in a country or practicing in a country where cost is a major issue. So apart from cost, there is the cost benefit awareness is not there. We cannot, for example, compare a CBC with an NGS because the purpose is different, the benefit is different. We cannot compare a PET CT with an MRI. So similarly, the cost is a major issue. Be it NGS equipments, reagents, the workforce which is required to operate, the softwares which are required to interpret the results, everything adds to the cost so much, and for the patient to pay that, I think it's very important that the workforce awareness is there. The workforce means your technicians, from technicians to molecular pathologists to a molecular radiologist or a clinician, to know what test is actually required. when we talk about NGS, NGS is not just one test. NGS is a technology. Now, we don't tell a patient MRI kara lo, we tell the patient kaun sa MRI karana hai. So similarly, for NGS, I think it's important to know what we are looking for in as an answer. Are we looking for the risk the patient has? Are we looking for the prognosis, or are we looking for the treatment? Because when the patient is paying out of the pocket, we still get patients who say कि डॉक्टर साहब ने 8,000 का टेस्ट करा लिया, कुछ निकला तो है नहीं. That distrust is there because we don't have an answer to the patient that a negative report is a good. I think we have an answer if it's a negative report, or we have an answer if it's a positive report. Secondly, if we have panels from a 50 gene panel to a 500 gene panel, or a whole exome, whole genome. If it's a cancer patient, for example, who is paying for his treatment from the pocket, all the tests from the pocket, and then we ask the patient to get a 500 gene panel done, wherein the targeted therapy which I get in the report is not even available in India. Or if it is available, it's going to cost lakhs in a month, giving that patient a 6-month benefit. So it's very important to know what kind of cancer the patient has. Is this NGS, or is this particular panel going to help that patient or not? So these are called evidence gaps, and I think these gaps are really making this is a beautiful technology which is becoming infamous in our society particularly, and that's why the trust on that is so once that happens, I think that will be the time to maybe create policies to support the patients and the clinicians together. Secondly, standardization is a very important gap, I think. In diagnostics, we have external quality assurance schemes for everything except maybe NGS today. So everyone is working in their own way. There are no set guidelines, there are no set quality guidelines. So everyone is working out of their own subjective knowledge. So that is one big gap which needs to be filled. And I'd also like to add data privacy. There are no set guidelines on who owns the data, for example. Is it the patient's data? Is it the lab's data? Is it the hospital's data? Or is it government's data? We don't know. What happens there is when we don't know who owns the data, we don't know who can use the data to develop AI algorithms, like ma'am mentioned. A pure, clean data set is very important for AI to help us, basically. And today, the data that we are working on is not even majorly on Indian population. We belong to a country of so much genetic heterogeneity that no two people are same, no two cancers are same, no two diseases are same. So, and we have moved on from, just telling the patient that you have lung cancer. That's not enough. That's incomplete diagnosis. So, I mean, nobody can do anything about it. So, I think these are certain major gaps which need to be filled, but these gaps cannot be, like, we cannot straight away jump to a multimodal, AI model. We have to, I think, take smaller steps. For example, firstly, accessibility of the equipment, accessibility of the technology. We need to look at the journey and how to streamline it from sample collection to report generation, who is supposed to do what. We need to work on a hub and spoke model, because the major, I think the major strategy behind reducing the cost in NGS is pooling the samples together. And that's where hub and spoke model comes in. It has to be a centralized testing where sample collection is decentralized, but the processing happens in certain certified labs only. So, I mean, I think there are still, it is coming in, but we are still few steps away from actually adopting it, and we need to be considerate of all classes of population in the country. We can't be writing a 2 lakh rupee comprehensive genomic profiling for every patient who is probably mortgaging the house for even a chemotherapy session. So yeah, I think we need to work on that.
Yeah, thank you so much. Lots of important suggestions there. Dr. Anu, over to you.
Yeah, actually, as Dr. Shelley suggested, she's quite right. There are multiple gaps are there, starting from the infrastructure, because it needs a different setup, and starting from the compliances, what have to be met, and whether, and then there is a very, very important is there are no regulatory bodies who decides that this is the how the report should be, these are the criterias, and these are the particular conditions where the sample has to be transported, because we all know there are pre-analytical areas where there's multiple issues are there, especially for liquid biopsies. When we get from the remote areas, those cells, they disintegrate. And to ask a cancer patient again for the repeat sample, and again getting it transported, we have no guarantee that it will not get disintegrated. So even if we want to cater to those aloof, very, peripheral areas, so we have to have a integrated methods where actually we can give a good quality results, and which is as per the guidelines, it is like accredited by the CAP or by the, which is like, approved by different associations, or which guidelines we are following. It should be very, very clearly mentioned whether we are following the CLIA guidelines or we are following. So everything has to be very, the clarity, the transparency, everything has to be maintained. When we are running a genomic labs, and when the oncologist wants to know, and they want to have the access to the raw data. So that kind of accessibility should be there to make their clinical decisions, because they are very critical decisions for the patients, and if they want to give a personalized or a particular target therapy, so they should have the accessibility. So it needs a lot of transparency, it needs a lot of compliances, your quality, and as I suggested, and she also said, that there are very limited EQUAS available. So NABL is also there, but then there should be some system where a lab who is performing can actually do an ILC which we can compare. So that kind of interoperability should be there. And then obviously the awareness, the technical staff, the data analysts, the softwares, everything is so expensive. They are all high-end. Like if you need at least for those software should have at least 15 GB, processing, and plus 10 terabytes minimum. And then again, the quality of the samples which we are receiving, that is also again very, I never wanted to disclose, but your mother had come with your blocks, and then we were asked whether there is still some sample there, because she wanted to send it somewhere for the further analysis. Then it was very difficult because it has gone so many places. So there was hardly any tissue biopsy left. So we didn't want to use it further, so that we are not losing, because the tumor, when there is a cutoff, that should be a 30% tumor, and at least for smaller biopsies, 20% of tumors should be present. And it has gone to different places. So imagine a person who has gone through the dilemma of having cancer and then has got it. Obviously, we all get it, a second opinion, third opinion. And when then suddenly you are told that there is no enough tissue to get your further, genomic sequencing done, it's heartbreaking. So it is very important for us all to understand that how to preserve that tumor. Unnecessarily, don't get trimming done, don't destroy those tissue blocks, and then wherever the tumor processing is done, how important is the fixation? If it is not fixed properly, how am I going to report? So it is very, very important to have the strict quality, strict compliances, my trained staff, then the other infrastructures like your softwares, your, even the bioinformatics, where you can actually combine with your mathematics, datas, everything work together. As she said very correctly, all these studies have been done abroad. But how many Indian studies are available? How much of Indian data is available? So that has to be, communicated, it has to be integrated, maybe with the labs which are doing it, the diagnostic industries, and then giving a tertiary care by having, those PPP models, or having the government infrastructure. There are lots of clinical trials, they go on in AIMS and IIT and all these data analysts are together working together. So one person or one, the infrastructure alone cannot do it. So it has to be a combined effort. It has to be without that it is not possible. And then obviously insurance companies, they are not covering. But one good thing, when I was scrolling through, I was quite impressed by Star Health Insurance, where they have given a topic about the NGS in lung carcinoma. So how it is cost effective, how the patient can actually save money.
Yeah.
So that was very good.
Yeah.
I was quite impressed.
You had a comment.
Just to
Dr.
add to that, I think the problem is that we are all still living in data silos. Everyone wants to somehow protect the data and not for some reason not give it to anybody. And even today we have patients who are carrying their reports of like last 5 years in a polythene bag, and there is not digitalized, and it's just so hard to find what exactly happened 5 years back. If I want to ask a patient, okay, you had breast cancer 8 years back, the patient has no idea what was the hormonal status back then. So, these are very basic things which are very important in molecular diagnosis and, using it to the fullest extent. And that's where I think the patient is paying also and not getting the answer also. So usage of data is very, very critical right now.
Yeah, and actually that's why we had to actually come up with the digital health mission. That was the whole point, right? The interoperability and all of those things, standards, privacy. Actually, that's supposed to address all of this, but
Yes,
obviously.
now the new data has just come, the Data Protection Act, which is like on 14th November it was released. So then
But implementation is the problem.
Implementation is the problem.
Yeah, because also we have this federal structure, and also states kind of want to do their own thing at many levels, and then there's public, private. So it is difficult, but I mean that was the idea behind that mission, and I think if we can implement at least some of the things that we've kind of promised there or set out there, then it would make a difference to some of these aspects at least. Cognizant of time, so Dr. Kapoor.
So regarding the data, like I'm sure in times of COVID, like many of us did, get CT chest done of some of our known tools or ourselves. If that data also is still available in today's time with us or under one roof, we can extract a lot of information from this data. If everything is segregated, organized, and there is availability of previous data. For example, in a CT chest also, we can see for any lung nodules, we can see for a calcium score to predict the risk of atherosclerosis. We can see for risk of emphysema, even bone density, if we extract with the help of AI from the previous data. If I talk about the CT scan abdomen, we can even see for the fat quantification from the liver, as well as about the muscle bulk regarding the sarcopenia. So this would avoid repeat testing and avoid the overall cost burden on the patient if actually the precision diagnostics are to be in place and used the right way. And last point, I have a 7-year-old son who, I always at the end of the day, he tells me what he did in school. So in his computer, he goes to the same school as I go. In his computer class, he now these days in 2nd class is studying about artificial intelligence. So, such topics about precision medicine, predictive, medicine, early diagnosis, whether we'll get this disease or not and how it should be done, should be incorporated in school itself. Of course, not at such a tender age, but at least 5th, 6th or 7th class, where people are actually aware. Along with the clinicians, the masses need to be told, how advanced the medicine has become and how they can actually use it judiciously going ahead. They should be aware of all this.
Yeah, no, that's very important. And actually, the point you made that sometimes the simplest of tests also, there's a lot you can infer. It also depends on who's looking at it, right? A simple X-ray, you can get a lot of information from that. And there are companies, startups trying to do that, from an X-ray how much can we extract, or an ultrasound for that matter. I mean, you know, initially all I had was a simple abdominal ultrasound, and the person who was looking at it was able to say that, you know, you have a big problem in your liver, but it's not originated in your liver, it's come from somewhere else, you know, which was amazing. It's just a simple ultrasound with no contrast and no dyes, but just the eye, you know, looking at it, the experience, it can make so much of a difference. So there's a lot we can get from these, you know, reports and images that maybe we think are, you know, not that sophisticated in terms of technology. Yeah, thank you so much for that. And finally, last but not the least, Dr. Gupta.
I think my point of view is that at least version 1 we can start as early as possible, starting from digitalizing your hospitals, so that there should be integration with LIS, with HIS, with EMR, so that pathologists, histopathologists, microbiologists, clinicians, they can speak to each other without interfering each other. They can see each and every record of patients. Pathologist before reporting, he can see the clinical history, everything he can see if EMR is integrated with the LIS. If LIS is integrated with the lab machines, then definitely the error can be reduced, and machine learning is already there. If we can enable AI with these all machines, so that screening can be done at first stage, or so that the workload can be decreased for the pathologists, histopathologists, and they can do quality work. They can do not show the normal slides for the screening purpose only. They can focus on the abnormal slides. They can take, as Dr. Saab said, they can take second opinion, third opinion from anywhere in the world. If they have integrated system that can be integrated with, and if the slides are digitalized, these slides can be sent everywhere. Like if we talk about MRI, CT or cath lab, the films or the CDs, the NGO reports, they can be sent anywhere in compressed form, and every second, third opinion we can take it from anywhere in the world. So I think if we digitalize first our hospital system and make a team of multidisciplinary team of doctors, so that we can provide patient-centric treatment, like pathologists, microbiologists, histopathologists, radiologists, primary clinician, secondary clinician. If we work together like a tumor board or something like that, not for tumor only or cancer only, for other disease also, rare disease also, so that they can speak to each other and do whatever is best for the patient. And definitely best thing, the vision is, the Government of India vision is also, our vision is also, there should be fully interoperability also. If we have ABA ID, if we have all the clinical records inside the system, and it can be accessed anywhere in the world, anywhere in the India, with the just proper login and ID and the consent of the patient, so that the treatment, the prognosis, outcome, everything can be improved, and the data leakage and data like keeping the records in the MRD or the patient house, it is also can be reduced, or there medication error, complication, all can be reduced with simple one thing, that if it is all data is digitalized in the ABA system or something like that, where like Modi ji has a great vision. If we fully implemented that system in our India, I think it will be the game changer. It will be revolutionary in the healthcare in India, and we will reduce, I think we will do lots of cost optimization also with this, and clinical outcome will definitely improve. Thank you so much. Thank you.
Thank you. Thank you so much. I don't know if we have time for a question. No? I'm being told we don't have any time for a question. All right. But I think we had a great panel discussion. So thank you to the panelists. And we have so many tangible takeaways as well, I think, from a policy perspective and overall also for all of us. So I think it's been a fascinating discussion. Thank you so much, and thank you to the audience for listening. Sorry we couldn't take a question, but I'm sure you can catch the panelists off the stage and, you know, ask them if you have any burning questions. Thank you.
Thank you very much. A round of applause for our learned speakers. You can connect offline during lunch with our esteemed panelists for questions. I now request Ms. Nikki Gupta to please join us on stage for the felicitation ceremony. Ms. Nikki Gupta, co-founder, IHW Council. Can we please welcome Ms. Gupta on stage? And we'll now be presenting mementos. We'll begin with Ms. Anu Kundra to please step forward. Kindly keep the applause going as we present a token of appreciation to our esteemed panelists for sharing their expert insights and sparing their valuable time for us. Ms. Shelly Mahajan to please step forward. Kindly keep the applause going. Dr. Akar Kapoor. Kindly keep the applause going. Dr. D.K. Gupta. Kindly keep the applause going. Session moderator, Dr. Urvashi Prasad. Now request the esteemed panelists to please come together for a group photograph. Thank you very much. Ladies and gentlemen, we'll now pause for lunch. We'll take a 45 minutes lunch break. Lunch is organized outside the hall. Kindly reassemble at sharp 2:45 p.m. for our next session. Thank you very much.
Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national. From Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India.
Ladies and gentlemen, we'll begin the session in 2 minutes from now. We request all to kindly be seated. You may inform your colleagues and request you to join you inside the hall. We are starting in next 2 minutes. We request all our delegates to kindly join us inside the conference hall as we are starting in next 2 minutes. Welcome back, ladies and gentlemen. After a rejuvenating lunch break, let's begin our next panel discussion on the theme, Smart Technologies Improving Clinical Outcomes in Specialty Care. This session brings together specialists from oncology, orthopedics, home health care, and critical care to explore how AI-enabled diagnostics, robotic surgery, remote monitoring, advanced imaging, and precision care workflows are transforming outcomes in specialty care. Our esteemed panelists are very much here. Kindly join me in welcoming them on the stage. We have with us Dr. Ashish Singhal. Can we please together welcome Dr. Ashish Singhal on stage? Robotic joint replacement surgeon, Paras Health Udaipur, a globally trained expert transforming precision orthopedic care through advanced robotic techniques. A very warm welcome to you, sir. Joining him on stage, we have with us Dr. Manish Singhal. Please put your hands together and welcome Dr. Singhal. Vice Chairman, Medical Oncology, Yashoda Medicity, a leading oncologist known for research-driven compassionate cancer care. A very warm welcome to you, sir. We also have with us Dr. Gaurav Thukral, co-founder and president at CAH. Please give him a warm round of applause. A pioneer of home-based clinical care and India's most advanced hospital-at-home models. A hearty welcome to you, sir. And this session will be moderated by Dr. Ajay Bakshi, co-founder and CEO, Nuance AI. A very warm welcome to our esteemed session moderator and panelist. And I now hand over the session to Dr. Bakshi for further proceedings.
Good afternoon. I hope all of you had some coffee. We'll try to supply some caffeine through our discussions. Let us start by acknowledging the fact that if your name is a single, you are likely to be specializing in smart technologies. So there is a non-statistical survey over here. We have 2 doctor singles over here. It's a privilege from my side. I'm a trained neurosurgeon to be interacting with such elite specialists. We have a intensivist, we have a orthopedic surgeon, of course, and we have a medical oncologist. So what we'll try to do is give you a bird's eye view of what leading practitioners are seeing in the space of smart technologies, right? But if you allow me, the panel, I'll take 2 minutes to first define what these words mean, because otherwise everybody has a different interpretation of what is technology and what is smart. So let me start with technology. Technology is a tool, essentially. In a way, it is the most defining characteristic of a human being. There are a few birds like crows which can do tool making, but the real reason why humans are the most dominating species on earth is because we can make tools to solve problems. So in a way, a wheel is a technology, a printing press is a technology, an automobile is a technology. So a technology is nothing but a set of tools which we use to solve some problems in the external world. So that's the technology part. And we have seen, you know, we're living in a technology revolution, so to speak. The smart part is, again, loosely defined, but as a neuroscientist, I would put in an intelligence lens to that. That what does smart mean? Smart means that you have some intelligence in that tool. Now, what does intelligence mean? Is that you are able to do 3 things. You are able to perceive the external world, which our brain does. You are able to process that information, and you are able to take some action on that information. So 3 steps: perception, processing, and action. This is what, in a very crude way, is are 3 essential parts of intelligence and of any smartness. So if you are just smart in better perception but can't do anything with that, I would still hesitate to call it a smart technology. If you are just smart at analytics, you're fantastic at looking at a lot of data, but you don't know what to do with that data as a technology, then again I would hesitate to call it smart. It's a sort of a spectrum. I don't think it is binary, black and white, but I'm just trying to put a sense of clarity on what some of us who deal with technology in healthcare a lot feel that what a smart technology solution should look like, right? So with that framing, I'm going to request each one of you to first do a broad survey of your area of interest. If you're an orthopedic surgeon, you're invited to talk about what are the smart technologies that you have seen emerge, other people are using it, and even maybe 12 to 18 months from reaching the patient. In a way, I'm sort of, what should I say, restraining the scope to not go to those science fictional, things which are going to happen in the next 10 years. That is hand waving that any one of us can do endlessly, right? So for this audience, I think what we want to do is what is real, what is going to impact patients in the next 1, 2, 3 years at most, not 10 years, 15 years, right? So maybe if I may start with Dr. Ashish Singhal, the orthopedic surgeon, and then we'll go to the other panelists, and then we'll do a round 2 after that, which is more deeper. Over to you.
So thank you so much, sir. Good afternoon, everyone. So I will broadly place these technologies or maybe advancement in 3 things. First is the surgical technology or robotic arm, which helps a surgeon in performing the surgeries. So we have robotic arms. From past 10-15 years, there is a navigation system which surgeons are using for spine surgeries, knee surgeries, and hip surgeries. Now, from past 2 years, there is a HoloLens or lens also which is coming, which is much user friendly and can be used and gives us real-time data for the precision and accuracy to perform surgeries. Second broad aspect is in the diagnostic tools. We have come up with specific MRI tools and some nanotechnology chips also, which we can put in our implants, which help us to find out the muscle power, the range of motion, and the patient satisfaction and the functional ability with time. So it also helps in improving the implant design, and also tells us what things can be done for the increased satisfaction for the patient. Now coming on to the implants, there are smart implants which are coming for younger patients who have growth rehabilitation or retardations. There are smart nails which are coming, which we can program from outside to increase the growth. And some nanochips are also coming. Recently, you must have heard that China has come up with a super glue, which will help in healing the bones. That will, maybe in longer run, will reduce the use of metallic implants. Last is rehabilitation and telemedicine. So in that, which would very useful in sports medicine, rehabilitation, physiotherapy, which is being used by good sports center, rehabilitation center to see whether the patients are getting if they're bowling action or the football injuries, what are the problems which are causing repeated injuries and how can they be avoided. So these are the things I think in orthopedics, these advanced technology are helping us.
Fantastic, fantastic. Thank you for that. So if I may paraphrase what you said, since you have a lot of experience with robotics, can we argue that a robot makes the surgeon smarter? And if so, how? Maybe because everybody hasn't seen a robotic knee replacement. So if you could just describe how your surgical skill becomes better because of a robot, that will be very illustrative for everybody to understand.
So very correctly, I would say, I have been performing knee replacement surgeries from past 13 years. And there are still, even after, and I've done almost 10 to 12,000 joint replacements. Even after so many numbers, there are almost 7 to 8% of the patients who are not fully happy or satisfied. So I went deep into it. I attended many conferences. Then I get to know there are some human errors which can be preventable by the use of these technologies. As in, some patients have varus deformity or bow legs in their genetics. And if a patient comes to me with 20 or 30 degree varus deformity, and if I correct it completely, then from past 60 years, he is walking with deformity, is very comfortable, and I have corrected completely, then he will not be happy with the full correction. So with the help of robotics, with the help of that software, I can give a best functional alignment to the patient, which would be around 6 degrees of angle, which is acceptable. So that gives us a patient-specific surgery in which the patient is very comfortable. So from past 2 years, since I have adopted this robotic technology and we have recently completed 1,500 joints, my patient satisfaction ratio has almost reached 98 to 99%, which I think is a great difference.
Very good, excellent, very exciting. And to be doing this in a city like Udaipur is even more exciting because this is now becoming accessible to large sets of population. So that's great. So Dr. Manish, as I move to you, I want to just for everybody's benefit frame that oncology is one of the most exciting and vibrant area of research for the last maybe 20, 30 years and more so in the last 5, 10 years. So obviously there's a lot of innovation happening in new molecules coming on board. There's a lot of innovation on diagnostics. But can you help us understand this very complex area as to what are the technologies in the spirit that we discussed earlier that you are excited about and that you have seen evolve across the space? I mean, just help us understand this very complex space. And I would also request you to go beyond medical oncology because for us, you're an oncologist. So anything in surgery, anything in radiation, anything in diagnostics will be great to hear from you.
So thanks.
And I think I'll thank you first that you laid that explanation of tool to technology and then smartness so very simply. Even I understood it once and for all now. So oncology is a burgeoning subject, there's no doubt. And we are increasing and we are becoming more and more complex as we are proceeding. Complex for our own betterment. And I think because we are learning more. I remember the time in 2007 when I joined as DM student in All India Institute of Medical Sciences. I'm placing this story because it helps people relate. There was no lung cancer clinic. The 5-year survival rate was 0% of lung cancer, and the average survival was 6 months. So my HOD used to say that just refer them to Safdarjung Hospital. We can't waste our time on lung cancer. 2010, when I was passing out, we had a lung cancer clinic. My immediate junior, who was a professor of lung cancer in All India Institute at this point in time, wrote a thesis. We published data of 12,000 people in American Society of Clinical Oncology, and that is what changed lung cancer within 3 years. Why did it change? Because we understood the genomics of lung cancer so very well. The survival rate, which was about 0%, in today's world is standing at around 25–30%. That means we are able to save about 1 out of 3 patients in lung cancer. And this story is just not true for lung cancer, it is true for many other cancer types. So how did it happen? So we were able to dive deep into the genomic makeup of the cancer, answering why cancer happens and how we can treat it more smartly, right? So simply put, bringing in personalized treatment. So of course this was not one-day story, it is a long story, but simply put, we are able to dive deep into the tumor DNA and genomically sequence it and find out which mutations matter. And then, going ahead, we can design treatments for common mutations, because these are not common for 2 patients, but it is common for a lot of patients. So if we were to say that total 1 lakh lung cancer patients are seen, or 1,30,000 lung cancer patients are seen across the world, new cancer cases every year. So even if it is 2%, it's a lot of number, it's about 2,000, or maybe even more than that. So those common mutations are segregated, and we are able to design drugs and then improvise on those drugs, 1st generation, 2nd generation, 3rd generation, 4th generation. So it's the very same way as we have fighter jets, 5th generation, 6th generation. Same way we are getting generations of drugs for which we are able to treat them better. And then we learn, how does this cancer become resistant to this particular drug? And then the cancer evolves, so as the medicine also evolves. So we take a biopsy from a patient who has become resistant to a particular drug. We take another biopsy, we subject it for another mutation analysis, and we find out, okay, now instead of this mutation is active. Now we have a drug against this mutation. So the thing keeps on evolving, and we also keep evolving, the science is evolving. So I've given you one very simple example, this is a real example. So that is how science in oncology is evolving as far as medicine is concerned. Now coming to radiation. I'll just sip some water. So as far as radiation is concerned, so now we have very smarter machines. I remember the times when cobalt used to be used. यहाँ से radiation दे दिया, यहाँ से radiation दे दिया, पूरा सिक गया, and patient just can't swallow water. I'm talking of a head and neck cancer, which is very common in this part of the world because of the tobacco eating habit. And now we have machines which can do 0.1 millimeter precision. Can you imagine 0.1 millimeter precision? It auto-corrects. It asks the radiation oncologist for going ahead with that auto-correction. So we have at Yashoda Medicity a machine called as Ethos Hypersight. It does auto-correction. For example, if you have to radiate a tumor, say in the prostate, you cannot control the movement of the gas into the rectum. If the gas moves into the rectum, the prostate shifts on that particular day, on that particular moment. And you are actually radiating the rectum and not the prostate. So you are causing toxicity and yet not efficacy. The machine Hypersight detects that gas movement at that time, at that moment, and asks for auto-correction on that moment. The radiation oncologist sees the plan, presses a button, it auto-corrects. So this is what, and you do this on daily basis. So it's actually earlier there used to be a radiation machine with a small CT scan incorporated in the radiation machine. It's a CT machine in which the radiation is incorporated into it, so that precision radiation can be done. So now we have MRI LINAC. MRI based, we know that certain tumors are better seen, you are a neurosurgeon, you realize it, are better seen on MRI and not on the CT scan. You can't see a brain tumor on CT scan unless it is huge. But if it is on an MRI, you can do MRI LINAC machine. LINAC is linear accelerator, which is a radiation machine, and it does MRI imaging there and then shoots the radiation. So this is again a step ahead. One of its kind machine at Yashoda Medicity, nobody has it. So, so far. So we know that proton is better. We had been talking about proton centers. There is only one proton center. But with this technological advancement happening in photon, actually proton is likely to become redundant, because you are able to control the photon particles so very well because of technology, that the same technology and smart technology. So this is making a sea change in radiation oncology now. And surgery, I think he has already said, of course, robotic arms.
In fact, Da Vinci robot is mostly used by surgeons.
By surgeons. Pelvis is an area which is deep, like a basin, like a wash basin. You can't operate on a pelvis. And when you have to enter into a pelvis and resect a tumor, you have to do a lot of dissection. Now that dissection is not required because of the robotic arm. So you can do very complex surgeries with robot because you are entering a wash basin. It's like going like this, and the surgeon is not equipped to do a very long surgery in the pelvis, but now you are able to do with robotic arms.
If I can give an example of that, Dr. Somshekhar in Manipal used to do a thyroidectomy of a young girl through an incision in the axilla. Because if you have to make a big cut in the young girl's neck, then her future marriage prospects become difficult. So that is the power of Da Vinci robot, that you can do a thyroidectomy from an axillary incision. So fantastic. But before I go to the intensive care, I have one question for you. See, I have seen statistics of especially US, because US and West is maybe a decade ahead of us in controlling cancer. You would agree with that. And the biggest reason they are able to do it well is that they have nationalized screening programs which allows you to detect cancer at stage 1 or 2, where your survivals are in 80-90% range and not in 10, 20, 30% range. So India still struggles with a stage 3, stage 4. I don't know what your numbers are, but would love to hear how can we as a country build smarter technologies for earlier diagnosis of different types of cancer. Some illustration from you would be very helpful for people to think.
Yeah, right. So point very well taken. We definitely do struggle. Access to healthcare is a problem. So I think from that perspective, when you improvise on access, we know that a person who is staying 400 kilometers apart will not be able to have that access which a metro person has, or person living in Delhi NCR. So I think where we have virtual platform or what you call as internet platform by which you can actually access a specialist. So those platforms became quite evident during the COVID time. We were doing all online consultations, etc. So those things are definitely there. But I think it also requires a certain degree of awareness. And now with the digital platform being so active, the social digital platform being so very active, I think that particular awareness is also rising. So we do get a lot of early stage cancers. But we know that how cancer is, and cancer is a bad disease, so it would be. And many a times, despite a very early detection, the cancer still moves up and becomes metastatic, but that's beyond anybody's control. But yes, I think general awareness, spreading awareness is one thing, and then accessibility to medical care can be established through the digital platforms. I think this is what most important thing is. But first is awareness among common people.
So maybe in the second round, I'll ask you about liquid biopsy and why that is very interesting.
Yeah, so that is another subject. I didn't touch upon that because it's not yet approved. So what I think Dr. Bakshi was referring to was a simple blood test which can detect cancer much earlier than it occurs. The problem is the algorithms post such a positive test has not been laid. So for example, if you do a simple blood test, which is just about 5,000 rupees or 10,000 rupees, and it tells you that you are likely to be having lung cancer, and you do a CT scan, because all algorithms are post a CT scan, and the CT scan fails to detect any lung cancer. So sending such a patient off back home is very difficult. So what do you say? You are likely to have it. You don't have it right now, but you are likely to have it in the next 6 months' time, maybe 1 year time. And what if this person goes back and commits suicide or something else, something funny? So I think we're not yet there, because they have to, these such blood tests have been coming in for quite some time now. Last year I was on a news channel discussing this. So this was my fear regarding these blood tests, that we have to improvise the algorithms post a positive blood test if the CT scan is yet negative.
Makes sense. Makes a lot. Thank you. Thank you for that tour of oncology. Inspiring to see how progress is being made. So, Dr. Gaurav, you have been an intensivist for 10 plus years, and now you are building healthcare at home, which in my mind is a double benefit. Why? Because as a former operator of large hospitals, I used to argue that the future hospital is going to be 150% ICU, because people are going to be so sick, they'll have multi-organ issues or they'll have post-surgical complications, and that is one line of approach. I think your approach has been more towards what can we do in the house that prevents or allows the patient and the family not to take the person to the hospital. So that's a very important and sort of futuristic progression of medicine. Would you like to illustrate for us how your transition has happened, and what type of smart technologies are exciting for your whole industry?
Thank you, sir. I think from both the surgeon and the oncologist, we heard how medicine is becoming more and more customized and precise. And from me, you're going to listen something which is actually poles apart, right? They work in an environment which is completely controlled, right? Patient is in their control, in front of them, and the whole infrastructure is there to support and save lives. But what happens after the life is saved? 95% of our time, we are at home, and we are grappling with chronic diseases. We are grappling with ageism. Such a huge geriatric population which is going to double, right? And such an uncontrolled environment. In that environment, what you want is quality care. And you are still dependent on that last caregiver and that last nurse to deliver that. So what is your requirements? The challenges there are, how do you collect, how do you deliver outcomes? Thank you, sir. I think this Delhi pollution is killing all of us. So I think the challenge there is that how do you deliver, how do you predict, and how do you deliver the best of the outcomes? For that, you need data. You need to collect that data. For monitoring, you need that data. And then you need the right interventions at the right time in such a distributed environment so that you can deliver those outcomes. So how do you collect data? Well, there are a lot of EHRs which are available. Thanks to Wi-Fi and so many variables and sensors at home, a lot of things available. I can quote an anecdotal thing from one of the conferences which I had in Canada, which is one of the largest geriatric care market, where they are now moving from long-term care facilities to long-term care at home, where things like automatic lights which will have motion detectors, to even those automatic home cleaners, vacuum cleaners which don't have wires so that the patient doesn't fall by entangling into them, right? To medicine dispensers, where that gentleman who was on the stage gave a very, very simple thing, that it's so easy for you to hold a medicine and pop it in your mouth. But for me, my biggest fear is that if I open the box and the medicine falls down, my fear is that I will now fall down to get that medicine. So simple dispenser, which will make ensure that the medicine goes into his mouth and does not fall, is also a technology which is so important, right? So I think it's very, very diverse, and now making this all predictable with artificial intelligence, because data can be collected now, right? So this is a very different world, very big world, from where there is a stark combination. As I said, they save lives, but with us, we sustain lives and we recover lives. So I'll just want to shed more light about what Dr. Singhal said on rehabilitation. So as 13 years back, we started as a home healthcare organization. Sir rightly said, I came from Fortis as an intensivist. The problem we were trying to solve is that these patients were stuck into the ICUs. They wanted to go home. They didn't know where to go. Because as Sir said, मुझे डर लगता है उनको घर भेजने में. Right? हर डॉक्टर ने जितनी मेहनत करी है अपने पेशेंट को ठीक करने में, they don't want the patient ever to come back in the emergency again. So way back in 2013, we used technology to set up the first telemedicine ICUs at home. And we took up it across the country. What that helped us was to use the same technology during COVID to scale it to save 20 million patients through telemedicine. वो जो एक कॉल आता था ना कि अपना SpO2 बता दो, अपना BP बता दो, those were 2,000 nurses deployed by us for the states of Punjab, Delhi and Karnataka. So technology helped us scale at that time. That was a novel way of doing technology. Telemedicine ICUs were helping us. But during COVID, the second wave, which all of us have witnessed, when patients were dying in ambulances, what we did was, we gathered all our resources, put up oxygen concentrators, doctors, nurses into a hotel, and we made a transition oxygen facility. We were able to save people for those 5 days when they were not getting an ICU bed. And we saved thousands of lives in Delhi NCR. That told us that there is a space for transition care between the hospital and home, because everybody cannot stay at home or in the hospital. And this is a very evolved concept, again, in North America, in parts of Europe, Australia, where they have these long-term acute care units, inpatient rehabs, skilled nursing facilities, assisted livings, and long-term care facilities. What we did was, we put them all together. And now in these long-term care facilities also, there are a lot of technologies which are used. For these rehabilitating these ortho patients, neuro patients, there is one technology. Again, in technology, there are now many robotics which are available. For example, in neuro rehabilitation, the only thing which you have to do right is goal-oriented repetitions, right? For that, exoskeletons are available now. For swallow therapy, neuromuscular machines are available. They stimulate the pharyngeal and the laryngeal muscles. Repetitive upper arm therapies are available. Visual reality, augmented reality is coming in so that these repetitive movements do not become very boring, right? But I think on the backbone of all this technology is that how somebody who thinks that recovery is slow, you can gather all this data into a system, which is again a technology, and show real time to the family and the patient that every day they are taking a step forward towards walking back home. So I think I tried to cover a lot of things, from home care to our now subset of recovery hospitals, assisted living, long-term cares. In assisted living, long-term cares, fall prevention is becoming a very big thing. So again, sensors which will detect that patient has fallen in the bathroom or somewhere. Now there is a device which is available, which is like a fire alarm, and this device can tell you that the elderly was in the room till what time, in the bathroom till what time, what was the moisture of that place, ki bathroom ka darwaza to nahi khola reh gaya, right? What was the sleep pattern of that elderly? And then now devices are available. So there were so many fall detection devices which used to say ki hum ye bata denge ki gir gaya, and it could be false. But what happens if koi gir gaya? So now devices are available, so inflatable diapers are available, right? That if even the elderly falls, it will cushion the fall. Buzzers and alarms are available which activate the emergency response system. So there is a lot happening beyond the tertiary care and acute care, which saves lives and we recover lives. So that's all on the smart technologies which is available.
Thank you. That's a great overview of the field, and I think it's a very exciting space, and also a space for a lot of innovation. From what you're describing, a lot of ideas are being tested. I have one slightly non-technology question, but I'm curious about hearing your thoughts on that. See, within India, I mean, I'm just coming from visiting my mother. She's 86-year-old. She's on a BiPAP at home. I can go, my brother is there. But there are at least, I believe, 30 to 40 million Indians who are living outside India. Is there a bridge companies like you can build between these people in US and Dubai and Australia whose parents are elderly but they can't handle the maid servants remotely, and even the maid servant won't be able to give the sophistication that you're talking about? Is that even a space for
Absolutely,
that is
sir.
interesting for you?
It's a space where we are already there, sir. So in Hyderabad, which is our flagship, we have built up our first assisted living and long-term care facilities. And why these facilities are becoming so successful? Because these are based out of our recovery hospitals. In our recovery hospitals, we have HDU-like units also. We have inpatient single rooms, wards, everything. But the peace of mind of that son who's sitting in US is that if something happens to my mother or my father, there is a 24-hour doctor available, and not from a facility to be transferred into acute care. There is an intensivist available who will transfer the patient from the 4th floor to the 2nd floor only, right? But I think beyond that, and that's why most of the patients, or rather we don't say the patients, these are residents who are above the age of 75 years. Our eldest resident is 99 years. 70% of them are dementia, and many of them are on the wheelchair also. So that's the complexity of care, and hence comes the role of a geriatrician also there. And I tell you, I'm a physician, did my intensive care. I don't remember seeing patients beyond 75. And the geriatrics itself is a very, very big technological advancement which is happening, the way these patients are being seen. So from, sir, very simple things like now there are interactive faces like our Series and ChatGPT's interactive faces, which are for companionship, right? As I said, there are sensor-based many devices available, which I would say reduce the intervention of the manpower also, because many a times you just can't put up a caregiver and say ki sab kuch theek ho jayega. You need to monitor that also. There are many fall prevention devices which are also happening. But most important is that in these long-term care facilities, they all talk to each other. They all can empathize with each other. Their problems are very similar. Hence that community environment, they celebrate. We have a lady in Hyderabad's one facility. She's 96-year-old, has been a very successful lady in US, now is living there. She's so bubbly. She'll write poems. She'll go and talk to anybody who's feeling depressed. So I think with technology, that human element itself is there. To answer your question, sir, this space is growing, especially in the South. There are many organizations who are coming into senior care, assisted living, and long-term care now.
Perfect. Thank you. So before we open up to audience questions, I want to just take what you just said and give a medical, physiological fact that given that the audience is quite young, but we would expect that pretty much all of you should live up to 100. You would agree that in today's medical technology, if you are taking care of yourself, you should be able to live to 100. But the point I want to make is that after the age of 75, your physiology is almost like that of a neonate. This is one neonatologist told me that a neonate who's say 700 grams, 800 grams, cannot be given 1/3 of a crocin tablet, right? Because that's what doctors do. Oh, it's a small child, give 1/3 of a tablet, everything will work. Because what happens as you grow older is your liver capacity to metabolize drugs changes. Your bones' ability to heal becomes slower. Everything becomes slower. So there is a full science of geriatrics which is developed to not just extrapolate from a young adult physiology into a geriatric physiology, and that makes it into a very sophisticated branch of medicine, if I may say that. So with that optimistic note, please.
One story for the young population.
Please.
So absolutely, sir. Polypharmacy is something which is being looked after by geriatricians. When we were young doctors, हमें सिखाया जाता था एक विटामिन इस चीज़ का लिखना है, एक पेन किलर लिखना है, पेंटोसिड तो लिखना ही लिखना है. But now, as a geriatricians, they are being told how do you eliminate polypharmacy. A cardiologist would write 5 things and 1 vitamin. Then a nephrologist will also do the same. God forbid, oncologist will also do the same. My own father, who's 76-year-old, right? It took me 2 hours to shift through his all prescriptions and make 1 prescription. I was able to eliminate 10 medicines. Yeah. And he was eating all of them. For young people, how we are using technology is that sir ne neurosurgery kari. There was some unfortunate young person who had a RTA or a stroke, and now this person has been saved by sir. He has a tube in the nose because he can't eat, because there is a tube in the throat because he cannot swallow properly, and then there is a urinary catheter, and this young person who was sitting somewhere like this is now bedridden, encased in his own body, right? The first question this person or the family asks is, ये दोबारा कब चलेंगे? And sorry to say, the state of affairs is that in the best of the institutes in the country, everybody says recovery is a slow process. कोशिश करेंगे, लगेंगे थोड़ा time, right? With technology, we were able to change this. What we started doing is, using our own data, we started predicting milestones. And milestones are very simple. Sit, stand, swallow, speak, walk, go home. This is the simplest thing, right? We did it in a more clinical fashion. My physical medicine rehab MDs refused to do it. Sir, ऐसे थोड़ी होता, right? They refused to do it. Sir, ये तो मुझे पकड़ लेगा patient family कि आपने बोला था 21 दिन बाद tracheostomy निकल जाएगी, वो तो निकली नहीं, right? It was such a humongous task to tell them that this can be done. We have data to support it, and nobody is going to hold you, right? We started collecting data because of our own proprietary system, and today we are able to successfully predict and deliver recoveries milestones with 95% accuracy. We have defined in how much time for that patient we can give the fastest recovery. And it doesn't stop here. All the robotics and things I was telling you, again, a young stroke patient is bedridden and you're just able to mobilize that person. Now put this person on a robotic exoskeleton. He will walk 1,000 steps in 30 minutes when he's paralyzed. His lungs will breathe, no pneumonias. His cardiac output will be good, no DVT. And his brain will be wiring and telling all the symptoms you need to recover faster. Put up the neuromuscular stimulations on the pharyngeal region, recovery becomes faster. You put that augmented reality, right? And this repetitive movement of doing an arti becomes so interesting. Right? So I think technology can be used in a very smart way to deliver what exactly a young patient would want, that is that I need to get to walking as soon as possible.
So
thank you, sir.
Thank you, thank you. So what you're saying is be more aggressive and ambitious in your expectations. And then the doctors will also push you towards that. So that's very optimistic to hear. May I ask one follow-up question to each of the Dr. Singles? Can you, taking a cue from what Dr. Gaurav said, can you illustrate a particular case, one individual, where technology made a wonderful difference? Something you have done recently that will help people understand how in a day-to-day practice this thing is coming up.
So basically, recently we operated administrator of IM Udaipur. So he had he had multiple surgeries in his lower thigh, and he also had knee arthritis. So he was very scared because of the multiple surgeries on his limb that I don't want to, get removed those implants and also undergo a knee replacement surgery, which is not possible manually, because in manual surgery you have to remove all the implants because there is an intramedullary rod which has to be used for routine surgeries. So with the help of robotics, I made him understand that you don't need to remove all those implants. I made him understand, because as sir said, what smart technology is, we need to perceive the data. So we got the CT scan done. We collected all the data. We saw how much of the deformity, where is the implant, how can we avoid removing those implants. We process these data in a software, and then adapting those software through, we put the software in our robotic arm, and with the help of that, we take that particular cuts and were able to do the knee replacement and made him mobile from the same day, which he was, immobile and was on wheelchair for almost 7 years. So that was the way we made him mobile without removing the implants. So this is how the technology
Very
is
impressive, very specific. Dr. Manish, may I request you for a similar case study?
So there are actually multiple.
Whichever one you want to.
So the case which comes to my mind immediately is chartered accountant. I treated her for lung cancer in 2014, maybe 13. Of course, routine biopsy, again mutational testing, etc. And she responded, and then she progressed. And at that point in time, we started her on second-line chemotherapy as per the standard protocols. So she did well, and she did so well that she kept on doing well, and we kept on giving chemotherapy every 3 weeks for 10 cycles, then it became 20, then it became 30. Then I called up a colleague. She's responding. Till when should I continue? She's responding and she's tolerating. As per the book, you're supposed to continue till progression. 70, 75, and everybody was amazed. Yaar, rok do yaar, bas ho gaya. Kitni chemotherapy doge? She's well. She's a chartered accountant. She's going to her work. She comes only on Saturdays because that's her off day. And she takes a single room. She doesn't want to meet anybody. She doesn't go to the daycare center. Finally, she progressed again. We were about to stop chemotherapy. Then we thought that let's biopsy again. Maybe there's a mutation. And lo and behold, she had a mutation. And this was a BRAF mutation. And by that time, we had a drug for the BRAF. And it was available free of cost. The market cost of that drug was about 5 lakh rupees per month. Of course, she could not have afforded that. It was a Novartis molecule. And we wrote to Novartis, it was not available in the country, so they were ready to send it absolutely free of cost on a patient assistance program. So Drug Controller General of India runs a named patient assistance program through which you can get free drugs. And if you apply, so there's a process for that. We got the free drugs. She responded well. These were simple tablets to be taken. And she did well for another 1.5, 2 years passed by. And then she progressed again. Then we gave her immunotherapy. By that time, immunotherapy was in. So, of course, immunotherapy wasn't in up till that time. Again, immunotherapy, we had a patient assistance program. It was very costly. So she did well. And you'll be amazed to know that she didn't die of cancer. She finally died of COVID. Wow. So 8 years with stage 4 lung cancer and living through all these times, living happily with family, is something which we made a change. And these are not one story, these are everyday stories now. Because of the innovation in oncology, I think this is becoming more common, very frequent rather.
Fantastic, fantastic. Thank you to all three of you. I do want to open up for any questions that you might have. Please raise your hand, introduce yourself very briefly, and tell us what these elite specialists can do to inform your understanding of smart technology better. Yes, there's a gentleman, blue coat, light blue coat.
Thank you. Thank you for the session. I think, Dr. Ajay, can you hear me?
Yeah.
Okay, so I'm just taking a clue from what you were saying, right? And it also make a lot of sense, right? With digital AI technology, smart care, and smart hospitals now being there, and we were talking about that, the life cycle or the life expectancy should have increased, with the kind of technology and things, are there. My question is that how do we ensure that this is something which is achievable, considering, all the dynamics that we have? We know lifestyle is a problem, the food is not clear, now we are fighting with the air. All of this is there, right? And it's a situation where our parents now in 60s or 70s don't have a, wish to say, if, we say them that, may you live longer, they say, please don't give us this wish, right? So what is your suggestions, to all the esteemed guests here, that how do we ensure that, with so much of technology, so much of things improving otherwise, life expectancy, which should have ideally increased towards 80s, or 100s, which used to be more than 102 and 105, in eras that we have seen, how we can address this?
So,
thank you.
If I may, this is a general question. I'm going to give you a slightly radical answer, two-part answer. One is, each one of us is in some form of healthcare. Is that fair? Most of you are working in healthcare. I think we have to take the challenge on our own hands. What can we do to take our own specialization or field better? For a very long time, and I think the panelists will agree, we are all trained in a system where we are told that somebody in USA will do something and then we will follow, correct? And the idea of innovation in India was always not the first thing that was taught to us. That go solve Kala-Azar, go solve tuberculosis. It was all, rifampicin was the last drug invented for tuberculosis in 1956. Because USA doesn't care about tuberculosis. They care about MDR a little bit, but not about routine tuberculosis. So the point I'm making is, it's a complex problem. Life expectancy is the final indicator of a society's success, right? To some extent. So, so that's one part of the answer, that what can we do to contribute? I will also take you back to, say, a Charak Samhita. Very interesting. It's available. how many of you have read it? Not many. In that it is written that an average lifespan of a young person should be 100 years. That's why those 4 ashrams are 25 years each. And there is a detailed prescription given on what to do in eating, what to do in mental well-being, what to do in physical well-being. So there is a lot of knowledge in our own system, which is considered very superstitious by the so-called leading Western medical thinkers, which is very integrative and holistic. All of us are super specialized, and fragmentation is something that Dr. Manish, you talked about, that thing, or even polypharmacy example that Dr. Gaurav was giving. So I think there is some thing also to be done for each one of us to go back to the original holistic part of the ancient Indian system of medicine, and see what we can do to meld that into the cutting edge genome analysis and the cutting edge robotics that you're hearing here, right? So it's not one or the other. There is a huge problem of modern medicine, that is fragmentation. And Western society does not have an answer for that. They actually don't. Other than yoga kar lo, meditation kar lo, they don't have a systematic answer to that. So I think the opportunity is for us to invent that answer. That it's not that I'm going to give up medical oncology and go and take homeopathy. I don't think that's also the right answer. Many people unfortunately fall into that trap. So how can we meld the Charak Samhita with a modern medical oncologist is something that each one of us should explore and innovate upon. Would you like to add?
I'd like to add to what sir said, absolutely. We are seeing, we are even doing a study now on integrative medicine in neurorehabilitation, where modern medicine and Ayurveda are working together to get, again, patients to fastest recovery. But I would like to answer your question in a very different manner. So lifestyle interventions, pollution, water, food, कुछ change हो पाएगा, कुछ नहीं हो पाएगा, कुछ control में आएगा, कुछ नहीं आएगा, जो control में नहीं आएगा बीमार पड़ेंगे, इनके जैसे specialist और technology हमें फिर बचा लेगी और population elderly double होके रहेगी. So this is the reality.
Yeah, that is good. Thank you. Are we done? Okay, thank you. I think with that we'll ask you to close the session and then we'll go back to our patients.
Thank you very much. A round of applause, ladies and gentlemen. That was a very insightful and thought-provoking session. I now request Mr. Omer to please join us on stage for the presentation of mementos. We'll begin with Dr. Ashish Singhal to please step forward. We'll now present a token of appreciation. Kindly keep the applause going. Dr. Manish Singhal to please step forward. Dr. Gaurav Thukral. Can we give them a more energetic round of applause? Dr. Ajay Bakshi. I now request all our esteemed panelists to please come together for a group photograph. Thank you very much. Ladies and gentlemen, we request you to please remain seated as we'll now begin our next panel discussion on the theme Digital Platforms for Continuous Care, Apps, Virtual Hospitals and Home-Based Care. We'll quickly prepare our stage for the same and we'll begin in next 30 seconds. We request you to please remain seated. Our upcoming session will focus on the rapid shift from episodic hospital-based care to continuous tech-based enabled healthcare. Our panelists will discuss how digital therapeutics, virtual hospitals, remote monitoring devices, app-based care, hospital-at-home models are creating an ecosystem of proactive and accessible health services. The panel will spotlight how technology is enabling 24/7 interventions, reducing hospital load, and empowering patients to manage their health seamlessly. Our stage is all set and we are good to go. Ladies and gentlemen, please join me in welcoming on stage our esteemed panelists for our upcoming session. We have with us Mr. Vishal Gupta, Country Head Healthcare, Ingram Micro, an expert in healthcare, IT, cloud solution, and digital health distribution at scale. Can we put our hands together and welcome Mr. Vishal Gupta on stage? A very warm welcome to you, sir. We also have with us Dr. Sanjeev Kumar, Governing Board Member, NIHFW. Dr. Sanjeev Kumar, a global public health leader with 4 decades of national and international impact. A very warm welcome to you, sir. Now let's welcome Mr. Shailendra Sinha on stage, founder and director, IT Xcare, doctor at home, an innovator in virtual care, remote monitoring, and home-based clinical support. A very warm welcome to you, sir. And this session will be moderated by Dr. M.N. Rao, CMD, Golden Street Group, an entrepreneur, technologist, and visionary business leader with nearly 3 decades of leadership in pharmaceuticals, biotechnology, and information technology. A very warm welcome to you, sir. Can we once again welcome all our esteemed, distinguished panelists on stage? And I now hand over the proceedings to Dr. Rao.
Good evening to all of you. The task is very, I would say, a very difficult task because we have already taken the lunch and some of the food is already digested and the last part only is remaining. So that's what we are doing now. This task, I feel that it may be will be pleasant to all of us. So far, the discussion has taken place on care, patient care, when he comes to the hospital and when he goes out of the hospital. That is in patient care and also the post-recovery care. But there is a fundamental thing which is required, that is irrespective of the income levels, whether poor or rich, or especially the poor. So it means that the continuous care is required basically for to see that the strata, the lower strata, gets benefited out of this continuous. Though the word continuous is there, it is continual, this care. So now I would like to open to our esteemed panelists. You, all of you, give your, please, Mr. Vishal Gupta, please, let us start with Mr. Vishal Gupta, who is a well-known person in this IT space and also especially in the healthcare IT space. So please share your feelings about the continuous care, or rather continual care.
Okay, so a very good afternoon, everyone. I have been, CIO for the various corporates in India. I was advisor for ABDM, and now I'm heading the healthcare vertical. This is a quick introduction. So I don't know how many of you recall, the definition which Dr. Kapil Garg sir mentioned this in the first session.
also health and family welfare planning, health policy, evaluation, evaluation, and several things which are useful to the a great thinker, a think tank for the nation, and definitely all of us have to be proudful for the service which you are giving, sir. So we'd like to, elicit the same. What are your feelings on the continual care?
Thank you, Dr. Rao. I look at continuum of care not from hospital outside. I look at continuum care from womb to tomb. I look at continuum care with home in the center, because that is where you spend most of your time. And I will also look at continuum of care from natural history of disease and well-being. And we have integrated health and well-being organizing this meeting. So you have to start with when person is healthy and well. Don't start only when the person gets sick. So these are the three aspects which I look at as continuum of care.
Preventive. Yeah.
Thank you.
Thank you very much, sir, Dr. Sanjeev Kumar. And the same question, what are your feelings, sir, as far Mr. Salendra Singh?
Hello, yeah. So hi, good afternoon. So I'm Shalendra. I'm just, we are actually, no, I will just first brief, what actually I'm trying to do. Because what I understand is like...
Use case you discuss later. First, give your feelings about the continuous care.
See, continual care is like something where you have to understand the complete science of a patient. See, most of the time, what is happening, like, if you are having a trouble, then you go to a hospital and then you start, getting treatment of what is there and what is not there. But in case, it starts from you only, that first you have to understand what you are doing and where you are from, and then what all you can do in case of in your continual care is something which it starts from you only, and once you have it in you, and then you can just start connecting to the people. I think, I have.
Okay. Another, which may take us to a different subject, but continuous care demand actually arises from what kind of situations? Please. Vishal, please. Okay, Dr. Sanjay.
Okay. Continuum of care, and I've been listening to the previous session, very, very informative. I see two problems. One is we have so many innovations. We do not have a repository where we can put all of them together. I won't know. I have to come to one of the conferences like this to listen to what is happening. And each one of us is working, if I can use the word, in a well. We are working in our hospital or in our institution or in our company, and we are not scaling it up. Give you two examples. One is teleophthalmology was put in practice in the whole state of Tripura. They had only 9 ophthalmologists in the state. But every patient who came to a PHC was seen by an ophthalmologist through teleophthalmology. Only 5% of patients had to go to an ophthalmologist for further treatment. Telepathology has done a little better. I don't have the latest figure, but last when I heard about 7-8 years back, it was already working in 10 states. And what I heard today is very exciting, but my question is, when are we going to reach the last beneficiary? So one is awareness of the technology interventions we have, and second is the concern for when are we going to reach the last beneficiary. So these are 2 points I want to emphasize in response to your question, Dr. Rao.
Mr. Vishal, would you like to add anything on this?
I think Dr. Sanjeev covered it well. anything which comes with the tele, it can be tele home care, telemedicine, tele-radiology, tele-ICUs or whatever. It is a long list of the word tele. It started almost 2 decades back. We were the first one in Fortis. In 2003, we started a tele-ICU concept with the then promoter of Fortis, Shivendra and all. Right? We got many awards. It was a buzz awards at that point of time. But now the reality is how far we have gone so far. Is it available to the really required people who are the rural estate, tier 2, tier 3 cities of the country, right? Is it affordable? Do we have the right technologies? There is so much government push, as I mentioned earlier. ABDM, telemedicine is a big block, right? eSanjeevani is the largest platform in the country. We have a good hit, but it's still not popular. Abhim, Ayushman Bharat Health Information, right? The government is giving so much funds. Again, tele is a big part as a building block of that overall funding, but the states are not deploying. There are so many things, but it is not reaching.
Sorry to interrupt. Even funded scheme, even NHS comes into the picture.
Yes. So it is not going, it is not implementing on ground. That is the challenge which we are facing. That's why we call it there is a huge role of the health tech ISVs. Health tech ISVs like him, like many others. They can bridge that gap. They can, deploy their products in the PPP models. They can support the governments. Government has a limited kind of, executions in this country. They are good policymakers. The framework is set. Earlier, the issue was there was no framework, there was no policies before NHA, before ABDM towards the tele stuff, before, we call it the overall digital health stuff, right? Now the policies are set, there are building blocks, there is an infrastructure framework, there are, SHAs in each and every state established. Now that this is a role of the health tech communities to develop their solutions, to showcase those solutions to the government, come up in the PPP models. For example, I don't know whether I should promote someone or not, but there is one company I heard, Dogbox. They have a tele-ICU stuff. Very fantastic thing. So they invited me in the ICU of AIIMS Delhi. Very fantastic. Doctors are using. I witnessed that. I was so impressed. Out of my interest as a digital health executive, I went there. I witnessed that. All the doctors, all the nurses they are using, they are recording all the vitals of the patient in the real-time scenarios in the ICUs, and it was a fantastic stuff. I have nothing to do with that company, but I am just mentioning that. So there are so many other things. When I was part of ABDM, I used to interact with the Sood Saab of eSanjeevani Cell or Sanjay Sood and everyone. They are doing fantastic job, but still it is not adoptable, it is not reaching to the last mile of the country. So that is a challenge which we need to, I think, fix. Otherwise, we are on the right track, I hope.
Okay. Thank you very much, Vishal. And also thank you very much, Dr. Sanjeev Kumar. Okay, now that we have understood about the continuous care, and also as rightly conveyed by Mr. Vishal, now that all the policies, systems and procedures are being set, and also even on the funder also is set. So it means to say that what all of us think about what kind of technology tools, what kind of apps, or what kind of virtual or home-based thing that they work for this achieving this objective. What do you think? Please tell me, sir.
No, in my first two interventions, I talked about what is not happening. Now we should talk about what is happening, and there is a hope for us to use it. All of you are aware of ABHA ID, and I think all of us have ABHA ID. And in today's world, when you have non-communicable diseases, I've been living with one for last 20 years, so there are many who are living with it for 40, 50 years. And in this scenario, if I have my complete health record for last 40, 50 years on a tool like ABHA card, the clinician immediately knows which medicines I took 40 years back, what happened to me 40 years back, I may not remember. But that record is available, and he can fine-tune the treatment. So there are many such interventions, technology interventions which are available to us, but I think we are underutilizing them, and it should be made mandatory whether a patient go to a public hospital or goes to a private hospital, for every doctor to ask, where is your Aadhaar card? I'm sure every patient has, probably, at least those who have access to internet have those cards. And those cards can be updated, and the clinician can look at it to provide better treatment to the patient. That's one example of what is already happening, but we are underusing that.
Thank you very much, sir. So I just would like to add here, at least the government side, for example, Telangana government, and they already started. I mean, in addition to the current system of primary health care, secondary health care, and tertiary health care, they also started what you call as Basti Dawakhanas. In these Dawakhanas, you don't find any doctors. You find only the paramedics and nurses. That is a kind of the infrastructure available. Now again I'm asking to Mr. Vishal, what are the kinds of the apps or what are the kinds of the technologies available for this?
Okay, so that it's a kind of a huge session, but I will try to summarize for the benefit of the audience. That is something which I gave a complete session 2 days back in Kahotech in Bhubaneswar. Anyway, so digital health, I mean, most of the people say digital health is a complex, but I always go and it is not complex if you know that what kind of, your understanding from the digital health. So we made it very simple. I call it a kind of a core infra building block. Core infra means your PC, printer, laptop, servers, whatever a typical hardware which you need for any organization, we call it core infra. Then there is a layer of the core solutions. Core solution is the kind of a foundation building block for any sort of hospital, be it tier 1 hospital or tier 2 hospital. I'm not touching tier 3 so far, but tier 1, tier 2 at least, that is a combination of a HIS, some sort of billing, financing, accounting, and EMR software, which we call the primarily HIS software. And on top of that, the lab and radiology equipment integrated. A kind of a basic digital health ecosystem should be available in tier 1 and tier 2. Then there is a journey starts, which we call the journey towards the digitally smart hospitals, right? There are 4 components of the digitally smart hospital. One is the clinical excellence, second is the operational efficiencies, the third one is the patient delight, and the fourth one is the quality and the governance. Clinical excellence, any software, any tool which is going to help your nurses and your doctors, be it clinical decision support system, your ambulance system, your AIML systems, any sort of system which is going EMR systems, your voice recognition system to capture the EMR automatically and put it real time. Any sort of system which is ultimately helping the doctor so that they have more time, they can give that time to the patient back. Simply, that should be the aim of the IT. Second one is the operational efficiencies. Any sort of system which is going to help hospitals in terms of generating revenue, in terms of giving a better care to the patient.
Or reducing the cost.
Reducing the cost. Be it your parking system, your food trolley system, nursing system, porter management system, security management system, video analytics, CSSD, biometrics, blah, blah, blah. There is a huge list. RTLS based systems, AIML based systems.
Even barcodes come in.
Barcode scanning. There is a huge list of the systems, but there are almost 9 to 8 systems which should be kind of a mandatory or kind of a good to have solutions for the hospitals to have a layer of the operational efficiencies. Then the third layer starts. That is the patient delight layer. Whenever a patient comes to the hospital, starting with the parking, patient is stressed. It's not like a hospitality environment when you are coming to enjoy your holidays, right? Your every second counts. So how as a IT people you can create a kind of an environment within the hospital so that patient and the attendants feel happy. At least their stay, at least their stress you can reduce a bit by the intervention of the technology. That can be a video wall, that can be a digitally queue management system, that can be a kind of a smart porter management system, that can be a kind of a hospital navigation wayfinding system, that can be a token management system, or kind of a digitally kiosk so that they can do their transactions. Anything, any technology intervention so that the life of the patient, the life of their attendant is happy before and after stay and during the stay of the hospital. The fourth one is the governance, very, very important, clinical quality and governance. Anything which we call, like any system to be kind of a NABH governance, ABDM, GDPR, cyber security, or your data governance, DPDP Act governance, any compliance, any governance, any standards has to be made by this fourth layer. So if we have this fourth layer sitting on the two foundation layer, which is a core infra and core solution, then there is a kind of a complete framework which I call the digital health or the smart health, framework. Sorry, I summarized this because
Okay, it's a very nice explanation what Mr. Vishal has given. Would you like to add anything, Mr. Shalendra, to what he has said?
So, any system which helps the doctor to get the data, because nowadays any doctor, they rely on the data and the information of the patient. So if he is getting a good data from the patient, then I think that is going to help the overall system and the final outcome of the.
Okay, now that we have set the platform for what do you call, for continuous care. Okay, we all agree that any care is always on, accessible, patient-centric, but here the subject is beyond the hospital. So beyond the hospital, so meaning that virtual or home-based services. In this context, Mr. Shalendra, would you like to share on the point?
So this is what I'm working on. Nowadays everything is in the physical boundaries of the hospital. So whenever there is a problem, you have to go to some physical institution to get yourself treated. So let it be the clinic, OPDs, or a hospital. So patient has to go there, and concentration of the hospitals and the solutions is mainly into the tier 1 and metro towns, tier 2 and metro towns. And that is the reason people in the rural area have a lot of difficulties. What happens is like when this data, so it is in the boundaries, and what happens is the second solution is basically the teleconsultation, which has taken a good shape during the corona period. In teleconsultation, you can talk to the doctor from any distance, and but the problem with the teleconsultation is this is only a symptoms-based diagnosis, and it doesn't give any access of the patient body data. So I think the solution which will help the masses is where you have information and the complete data coming to the doctor, which will definitely help.
Thank you, Mr. Shalendra. Mr. Vishal, would you like to share on this beyond the hospital?
No, I think he is absolutely right. There are, as I mentioned, there are initiatives which are government driven. There are initiatives driven by the public player or the private players like him. But ultimately, where we are reaching, right? There are tools and technologies available, but who is going to integrate? Now we have a framework which we call the HIE framework in the country, Health Information Exchange. Earlier it was not available. Then we used to blame that hospital A cannot see the data of hospital B. Now we have health exchange available in the countries, but how many hospitals are in reality, integrating their HIMS solutions with the ABDM building blocks? Even if they integrate, how many, as you mentioned, I think you mentioned, how many citizens are aware of the ABHA? If you ask audience to raise the hand, if they are aware of the ABHA, you will not get more than 10% here. I did it earlier in many events.
Can you raise, any one of you, can you raise the hands that you are aware of?
Have you created your ABHA ID? How many? 1, 2, 3, 4, 5, 6.
Very few.
So we are in a health tech event, and there are 6 people in the room who are aware of the ABHA. So that kind of awareness, that kind of we have for our healthcare. We take car insurance as a mandatory stuff, right, for our cars, but there is a least botheration in our country for our health. That is very unfortunate. Anyway, so now the thing is, the health records of individual A can be accessed by the health provider A with the consent of the patient, using the health information exchange. So ABHA is the primarily tool for that. If you have not, created a ABHA ID for you, so my request to all of you to go back and do ABHA. It is a 1-minute process, and right now it is a kind of almost free of cost stuff, but that is much more powerful tool than Aadhaar or your PAN card. So you should create that you should enjoy the benefit which government is giving you with the part of the ABHA IIT. So another thing is, as you mentioned, that what is the thing, okay, so, you know, once the continuum care starts when the patient is coming to the hospital, there are tools and technologies so that you can aggregate your health records, right, from the various source of care. For example, if I'm a patient, I go for the lab test in Lal Path Lab, go Fortis, Apollo, Max, and then finally do treatment in Medanta. So all my healthcare records as a EMR should be available to me by the digitally at the point of care. That is one part of the continuum care. On top of that, there is a one building block we call the PHR. What about the health records which I have in my polythene? Someone mentioned here, I think in the one of the panel, polythenes, right? We used to go with the big polythenes to the doctors. So all the paper-based records, unstructured data which we called, should be converted to the structured EMR and should be part of my digital health records. That is the responsibility of the citizen. We are not talking about the rural India, but at least the urban India. Our health records should be the EMR enabled, right? So that whenever we need, we should have access of those health records. And that they should be the part of the overall ecosystem of the digital health ecosystem of India. That is one part. Hospital should use it. I get a treatment, I get a discharge from the hospital. After that, there should be tools and technologies, home care programs, telemedicine programs, so that I as a patient, no requirement to go to the hospitals, and hospitals is able, you know, approachable to me using the technology intervention. That is the overall ecosystem. That's what we call the continuum of care. That is, you know, I visualize the overall bubble.
Thank you, Mr. Vishal. Sir, we know that you are as far as the National Health Policy 2019 is concerned, you are the man behind that. So, what were the, are there any initiatives taken in this direction for care outside the hospital?
Yeah. I will again take you back to home, where 100% of health is produced. What you eat, if you do exercise or you don't do exercise, there are apps available which will count how many steps you have done. And there is a relatively new concept in exercise called non-exercise thermogenesis activities. You know, we tend to have remote for everything today, mobile in phone. Earlier we had to get up to go to the room where the phone was lying, or go to the TV and switch it on, increase the volume, decrease the volume. You have a visitor, you look at your mobile and see who's coming, and you open the door sitting wherever you are. So many of these activities have come down. But you have apps available which will keep a record of how much exercise you have done, not just gym exercise or other exercise, but non-exercise thermogenesis act. Similarly, you have apps. You can take a picture of your food plate and you will know what you are eating, how much you are eating. So 100% of health is generated at home. Like farmers produce all the agriculture in the field. Similarly, health is produced only in the home. So all the healthy lifestyle related intervention, tobacco, alcohol, and other things can be done only at home. So we should start from there, not look at it from disease point of view. Coming to the diseases, 95% of the ailments we suffer are treated only at home. Diarrhea, mild fever, cough and cold. So these are common diseases. Rarely most of us are health related or doctors here, but even layman does not go to hospital, and there are interventions available. I'll call it most important technology advance was oral rehydration solution. And when we were medical students, there used to be a separate ward. The moment you go to casualty, there was a dehydration ward, and all of us were trained in calculating how much IV fluid. Those wards have disappeared. So ORS was the first technology and was rated as the best invention of the last century. So this is in sickness. When you have a sickness for which you need to go to hospital, who detects the symptoms? Who is the first person you consult? Family, at home, or friends. Again done it. When you go to hospital, you have chest pain, breathlessness, pain radiating to the arm. When you go to hospital is also decided at home. The outcome in the hospital depends on what you do at home. So even for ailments for which you need to go to hospital, it is home. You go to hospital, most of the people, 99% go to hospital for outdoor treatment. For example, hypertension. The medicine is prescribed, lifestyle changes are prescribed. Who does it? Who reminds you? Have you taken your blood pressure medicine or diabetes medicine at home? So it is home-centric care we have to keep in mind, not hospital-centric care. In the discussion so far, we were looking at hospital-centric care. We need to look at home-centric care, and wherever you need help, you get help from the hospital, not the other way around. That is how I look at it.
Thank you very much, Dr. Sanjeev Kumar. Yes, definitely, this goes, without saying, in a country like India, where, of course, on the nutrition side also we are poor, and at the same time, budgets I'm talking about, and at the same time on the, also on the healthcare. So here the question comes, is that which way it is better to make India a healthy India? So is one of the approaches. So I hope in national health policy the same thing is pronounced. Okay. Now coming to the, all said and done, of course, we also realize that digitalization has an edge over all the other strategies in bringing the patient first to be at the home, only detected about his own problems, and then probably to the hospital level, right? So in that case, so what kind of technologies will help? Mr. Shalendra, can you please tell?
See, right now, what is happening is like hospitals and these places have become a hot spot of the other issues also. So if you go to a hospital treating for something, there is chances that you will get something else from there. So which is actually a big problem. We have seen it in a corona. The people who went to the hospital are, it has taken time and they got different things, after that. From home, connecting from home is always an advantage, but the tools presently are very limited. So like, I said teleconsultation. So this is something which is, you can connect to any doctor from wherever, of any specialty from home on a audio video call. So which is, I think it has contributed a lot in a teleconsultation. But we have seen that people are going back to offline consultation after corona. So if 10 people have gone for a teleconsultation during corona, 9 are back to offline consultation. So somehow I feel that, these people have not trusted that teleconsultation. Why? Because it is, there is no touch and feel, number one. Number two, there is no body access to the doctor. So doctor is also disconnected. So if you see and understand the data, good doctors are not willing to do the teleconsultation. They want the patient data because everything is based on the data. So what we are trying to do is like we have made a device and solution, which is there, like how you get the delivery of a food at your home from Swiggy and Zomato. We are trying to make healthcare to be delivered at home. So data is very important for that. So what we have done is like, first we have understood what all doctor does during physical consultation. And we have now translated into a device and solution with the help of which whatever doctor can do in a physical consultation is now possible through teleconsultation, added value and next level of the teleconsultation. So this device gives you the complete, gives the doctor complete access of the patient. So while talking to the patient, he can see all the live vitals coming on his screen at a distance. So while I'm talking to a doctor sitting as a patient from, to a doctor of a remote, so he can see my ECG, BP, temperature, respiration, pulse coming to his screen without any human intervention. So as good as a physical consultation. He can hear my sound, this heart sound, lung sound, auscultation also from a distance. So this gives a second access to the doctor to understand the body sound. And the third thing which is very important for a doctor is to do the physical examination of the body part also. Because you have explained the symptoms, he has seen your vitals, he has heard your sound, body sound. Now he needs some symptoms which is there on the body. So there is a special camera with the help of which he can actually see everything, like a pimple to a bleeding spot to a hair, eyes, skin, anything. So this gives a complete access and information to a doctor to treat the patient rightly. And this is made in such a way that, from there he will write the prescription, and everything is made in such a way that, patient gets this prescription online and he is being treated well. So once the doctor understands the symptoms and he relates with the data what he is getting live, then the right treatment will come, and everything is happening at home. So these type of solutions will definitely help the people to get treated at home, which has many other outcomes also, because cost goes down. You don't have to travel to the hospital. It doesn't take any time. So you are at home and you are being treated. So there is chances of getting the other things is also not there. So those things will definitely take shape. And what we have seen that there is a trust also gets aligned with the patient, because there is a touch and feel. There is a sensor. He knows that doctor from a distance is seeing his vital, and after seeing his vital and having all the data of the body, he is giving you the right prescription. So that is how it is going to help.
Thank you, Mr. Shailendra. Once again, Mr. Vishal, would you like to add anything to this?
I think so, as mentioned by Shailendra, there were many phases of tele, in last 2 decades. It was phone call to a doctor, then someone started a kind of a video to consult, then this telethrombolysis, telemedicine, teleradiology, all those things started. Right? There was a flavor of the video, there was a flavor of voice recognitions, but they all around the same stuff, right? But one thing which he mentioned is very right, that patient was always concerned that there is no touch with the doctor. That was the one thing. The second thing was, there was always concerns from the patient side that doctor is not having the right, vitals of my body. Right? So he is advising something which I am telling him. So there was always a, question mark, always a gray area. But these kind of tools where the data of the body is going real time to the doctors at the point of telemedicine, or the telemedicine is happening to the doctor, I think that is a game changer. But again, Shailendra, with the people like you, my question always comes that what is your GTM? How these kind of tools and technologies, how many people are producing? What is the roadmap to, kind of outreach these kind of stuff to the rural areas, especially where I see the gap of the delivery?
So this is what we have done, when we have actually made the device, we have done a pilot. We have tried to understand, what is the insight of a doctor and what is the insight of a patient after understanding it. So doctor side, it is like, any doctor who is not ready to do a teleconsultation is not ready to do a consultation, because he sees a lot of data. And patient side, he gets treated at home. And I will give you one example, like there was a lady which was in the elderly age, and she was from Bengal, and she was living with his daughter in Noida. And she was not willing to go to a hospital and show the doctor here. And she was very rigid that, no, I will show the same doctor which I used to show for last 30 years in Calcutta. And somehow that lady got us connected. So we said, okay, we'll just connect to the same doctor. So we have taken the number. So doctor was really surprised that he has all the data and information and history of the patient. He is understanding the present status of the patient also. And then the treatment went very well. So this is how this can actually open the physical boundaries and give a lot of solution to the people at home.
May I add,
Yeah,
Dr. Rao?
please.
Okay. We have technologies which help the healthcare provider in hospital. We have technologies which will help people at home to pick up problems early or monitor their lifestyle related issues. We need to bring them together. The doctor should be able to monitor how I am doing at home. Am I really doing? He will ask me a question, teleconsultation or without it. Are you doing exercise? Yes, I am doing. But when he has a record from one of the devices I am using, he'll be able to tell me, no, it's not sufficient, or you are overdoing it, you don't need to do as much. So we need to bring these two together. And let's not look at technology in isolation. Teleconsultation, etc., cannot be standalone. You have a mix of physical consultation, you have a mix of teleconsult. Patient goes, consults the doctor, is hospitalized, and then he is discharged. Now you can consult me online. It's not that every patient can have, getting data may be an issue when you're seeing a patient for the first time. You will not probably be able to provide. So we need to look at technology as an assistance to providing health care. So that's one point. I want to dramatize what you said. All of you know about Ahmedabad plane crash. How many people died? Inside the plane and outside, only one person walked out. That was a miracle. So 260 or so people died.
Almost all.
Yeah?
Almost all.
Almost everybody. Unfortunately, the doctors having lunch in the canteen also were victims. Imagine 30 Boeings with same number of passengers crashing every day. That is the number of people who die because of medical errors. They wouldn't have died had they not gone to the hospital. So hospital is an unsafe place. You should go to hospital, stay in the hospital only as long as it is required. If you're not in the hospital, you are safer. Almost 1/3 of the deaths in India are in the hospital are because of medical errors. So keep that in mind, that hospital is not the answer. In fact, it can create more problems. You may die or you may come back with a condition which you did not go to the hospital with. So this is one point I wanted to emphasize. But don't look at technology in isolation. Look at as an assistance to the family, to the patient, and assistance to the doctor. Thank you.
Thank you very much, sir. All three of you, I think, have given one common opinion that the digitalization or any of the digital applications, definitely, especially at the home basis, are nowadays are required, and nowadays they are useful not only at the home level, but then that home data, the data taken from the home, will be useful for consultants in independent consultants or the consultants in attached to a particular hospital, whether it might be a primary level or secondary level or tertiary level. Well, I think in that case, anybody would love to have such kind of these are not simply apps actually, they are basically the systems. And these systems, digital systems definitely, which are basically like physical consultation only. Give a feel that physical consultation and telecalls or any of these, when they are becoming, of course, in the context of COVID, they all worked. Of course, I think that has given the opportunity to even to, I think, how did you get this idea, Mr. Salendra?
So, see, I'm not from the healthcare background. So I was into the durable industry and I was into my corporate durable business. What has happened in my family, like my grandmother who used to be with me in Noida, and she was of 98 years. And whenever I have to take her to the hospital, it becomes a very big pain for me. We try to call the doctor, but after Corona, doctors have actually stopped coming to home. One doctor said, you take her inside your car, I will come outside the clinic and will treat her. Then I said, if I can take her to that level, then I can take inside the clinic also. And this was, I had some frustration there. Then what happened is like, I have tried some teleconsultation. And in teleconsultation, it was really frustrating because you don't know the doctor. He is not giving you much time. He's not going in detail also. He is just, in 5-10 minutes, by the time you are saying something, the prescription came. So again, I thought this is not the right way. And what has happened is like in Corona, peak Corona second phase, my mother had some teeth infection. And she was of 75 years. So I started calling the doctor. We cannot go out for a physical consultation. So most of the doctors said no, because 75 years age, this looks very bad. So one doctor said, put your mobile in her mouth. Give me the video and the picture of the inside and outside thing. And then if I feel it right, then I will give the prescription. So I have done that. It was painful for my mother, but doctor got the data. And he has given me the prescription, and after half an hour, she started recovering. So this has given me an insight that what all doctor needs, if he somehow can give that information to him, then treatment will not go wrong. The chances of error will go less, and it will be good for a patient if he can get treated rightly without physically going there. So this is how I started working on it, and what I have understood is like, first I have met all the doctors, tried to visited clinics, tried to understand what all they do during the consultation, the primary healthcare consultation, and then all those things I have tried to incorporate in our system. So for like in the clinic, if you go, caretaker role is very important. So if I am a patient, my wife will become a caretaker. He needs to see the data. He will hear the heart sound, lung sound, respiration sound. He will see the body part where there is a. So I have tried to incorporate all that, and into a given, a solution is being given where stakeholders as a patient and doctor and caretaker have given importance. And this is how I have worked on it, and then somehow reached the level where this is now working well.
Thank you, Mr. Sailendra. Being a, even I would rather say he was on the patient side, suffering from several problems in the corona time. And all of us have faced similar kind of problems. So being in the home, how to get everything, not only healthcare, but even groceries, even anything, any need we want, it should be delivered at home. Anyhow, I think he has come out to say, yeah, please.
Dr. Rao, since you mentioned Corona time, but post-Corona, what was our learning? Our learning was Amazon to get the stuff fast, Blinkit to get everything in 10 minutes, Uber, Ola, Swiggy, Zomato. So we know each and every app, they are installed in our phones to get the service in a minute, right? But how many of us, we have a app in case any emergency happens in family, do we have an app to call ambulance? Answer is no. 95% of, I did that survey myself, I did that. 95% no one aware whom to call, how to call. There are so many fantastic apps available, and by using those apps you can get the ambulance, state-of-the-art 5G ambulance immediately at your door, but no one bothers. But we have, kind of a Swiggy, Zomato, so that is a reality. So government is developing an ecosystem. They are facilitating the hospitals in terms of the tools and technologies. At the same time, health tech innovator like Salesh, they are developing so many tools and technologies and solutions. But what about the awareness? Awareness about the health, awareness about the emergency, which is a kind of a great sense of responsibility that is missing. I feel that is missing in India.
So I would just like to add here, if you ask our awareness and the way how we treat ourselves, if you go to a clinic, pharmacy somewhere, anywhere, and you sit there for half an hour or so, you will find 2-3 patients coming directly asking the pharmacy person that I have this problem, give me the medicine. And 90% of them will give the medicine also.
Self-medication.
So this is how we treat. So when he's saying about the awareness, so actually the change has to come from us. And if we are able to start understanding, I have seen a lot of applications. We as an Indian, not habitual of using a lot of gadgets. So I have seen, I will give you my personal example. There is a IoT thing which is taking a lot of space. So I have all my fans, in my house, which is IoT, and you can actually use the remote to control the speed. So first 1 month, 2 months, everyone in my family has used it. But last 1 year, it is lying idle. So people go and switch it on there directly. So this is how we have to change as a human being. And if you are able to understand it rightly, I think there are solutions which will help you to get the things right.
Thank you, Mr. Salesh. Now it is not only the Internet of Things, but it is Internet of Medicine. That is what we have to change that to not IoT, IOM it is. Anyhow, it is an angle which is definitely, is helpful for the masses. Well, here one subject I just would like to bring in. How it will be useful for the private or public health providers starting from PHC or secondary level? Mr. Vishal. The question is, what I am saying is, home-based apps are available, right? Or apps or devices are available, right? How it will be at the level of whether private or public, the hospitals which are there at a primary level or secondary level, how it will be useful for them.
You mean to say T2, Tier 3 hospitals?
I have a few suggestions on that. Every health facility should become a digital hub. If I walk into a health facility for outdoor or for indoor, they should ask me, do we have an registration? Very simple, takes you 5 minutes. When I did, it was so easy. If you have an Aadhaar card, it doesn't even take you 5 minutes. You can do it so easily. So that then the people will be educated. If there is a related app you can use at home, for example, for, as you said, for calling ambulance, they should help me download that. So every healthcare provider, right from accredited social health activist who looks after 1,000 population, now they have in urban areas as well, they should be trained. Use these apps and then help people to use these apps. And then you can scale it up. Then you can go to higher level facilities and outpatient or indoor, many of the relevant apps. I'll give you one example. Patients who get daycare treatment in chemotherapy, they are fine in the hospital. In the evening they come back, they start having vomiting and diarrhea. They don't know whom to contact. The surgeon never gives physician or onco-surgeon never gives phone number. So they are struggling to go to the public number of the hospital and then trying to get, if they get to the manager, and they lose hours of time. And if the diarrhea and vomiting is severe, they can go into dehydration and they may die of it, not because of the cancer, but because of the complications of the chemotherapy they receive. So I have a suggestion that every one of us, health workers and health facilities, should become ambassadors of using health technology. Over to you.
Yeah, shall I rephrase the question or?
No, I think let me try to answer. So Tier 1 cities is easy, low-hanging fruits for any digital company to manage, right? Or any hospitals to manage. There are big CEOs, CIOs sitting in all the corporate hospitals, big chains. They have a good understanding of the digital health. They have deployed kind of a basic or advanced solution in all the hospitals. The problem starts with the Tier 2 and Tier 3, right? They have a good intention for the digital health. They have a good budgets also, but they don't know how to start, from where to start. They don't have accessibility of the health tech companies like Shailesh, right? No one is going to them. They are in the Tier 2 cities, Tier 3 cities, having a good population of the patients. So what we are trying as a largest technology aggregator of the country and of the globe, what we are doing as a healthcare vertical. So we have created a kind of a framework where we have a basic technology tools for the digital health enablement, especially Tier 2, Tier 3 hospitals, 50 bed, 70 bed, 100 bed, or 150 beds, right? If you want to go digital, what exactly you need in terms of PC, printer, laptop, cloud, TVs in the patient room, CCTV, Wi-Fi, HIS, PACS, if you need or not, if you need, what kind of modules, what is the price, everything in a simple bundle. We call it health tech in a box. Similarly, for the slightly bigger hospitals, if someone is saying, okay, I have a basic, but I want to do slightly more. I heard something about the RTLS, I heard something about IOMT or AIML kind of thing. Can I get benefit of all these technologies in my hospitals in terms of the clinical excellence, patient experience, operational efficiencies? The answer is yes. Then how? Here is the framework. So we are creating a framework, but we are not developing any solutions. The players, the health tech players of India and global players, they are joining me, and the big OEMs like HP, like Cisco, they are becoming a part of our ecosystem so that we can deliver that kind of a framework, especially Tier 2, Tier 3 cities, to make their life easy. We have created a kind of a calculator. In that calculator, you just enter a bed size. If you want to create a, let's say, 120 bed hospital in Tier 3 cities, put 120, that's it. Within a minute, you will get what exactly you need in terms of the digital health, how much time it will take, what would be the cost, what are the modules of the various components of the digital health you need, right? What are the various partners? There is no one partner. What are the various health tech ISVs? How much time they will take? What would be the one-time cost? What would be the monthly cost? So everything in 1 minute. So you can take your decision fast. So that's what we are doing.
Thank you very much, Mr. Stahl. I think you have elaborated, both of you have done. One dimension I just would like to tell. See, I mean, whether it is, especially in private, whether it is primary or tertiary level hospital, the ultimate aim is that it has to, basically the revenue. As far as the revenue is concerned, it has to increase its revenue. And in that sense, if you see, the revenue gets increased only when there are more number of patients. And patients here, for large-scale hospitals, definitely inpatients. Not, okay. But then there is a situation here, in a long continuous care, I just would like to sum up saying that, see, a patient, first initially he may turn out to be only an outpatient consultation. But what happens, it gets evolved in such a way, especially in chronic diseases, and all of us know very well, and also in the lifestyle diseases. So it works out like with the data and the cross data, what he gets, the patient data, what the consultant gets. Based on that, he becomes what do you call inpatient also. For some time, he may become an inpatient, and afterwards he will again turn out to be outpatient. But in any way, after all, the referral system is already there for all the hospitals. So this is a kind of instead of not only depending on the referral system, but they depend on their own investments in the far off areas, using probably the nurses or paramedicals and all that, and then the revenue of the hospital can go up. Am I right? Number one. Number two, if this is the case with the private hospitals where the revenue is the objective, but then when you talk about the voluntary hospitals, and the voluntary hospitals, the objective is not the revenue, the objective is the coverage. As many. So given a budget of 1 crore of rupees, instead of covering, say for example, 1 lakh of patients, if this technology leverages to the extent of about 1.5 lakh, definitely it is so the voluntary hospitals also, it is a big leap and big advantage for them. So I would, I also wanted to ask about the use case, but then in the process of explanation, already Mr. Vishal and also Mr. Shalendra have given the enough insights into the, instead of explaining in a particular case, but they have already explained about the features of a device which is almost equal to the, not telecall or medicine, but it is equal to virtual, but it is equal to physical consultation. Yeah, I would like to now open it to the all of you. Any questions are there? We would definitely, our panel would be answering that. Please. Any questions, please? Shall I take it as there are no questions?
Dr. Rao, you made everything crystal clear.
Thank you very much. I mean, you made my job easier, actually.
Sir, I have
so,
one question.
thank you very much.
As compared to the conventional hospitals, what is the pricing benefit like? Like, are you keeping the prices as competitive as a hospital? Like, does the patient have to pay a little less as compared in telemedicine as compared to the?
Okay.
Yeah. Like, how are you making it competitive in terms of pricing and all?
Thank you very much. I would request Mr. Shalendra to give the answer.
So this is like, it is not only the cost, it is time also. Like how much time it saves for a person who is in a rural area to come to a tier 1 town to get the thing. Moreover, actually till the time the healthcare service is not affordable for the rural people, they are not going to accept it. And no social support thing, will work for a long. So these solutions are actually affordable to a very great extent. So other than the one-time cost, the consultation cost can be as down as 50 rupees per person per consultation. So this can actually do a lot of magics. But now the thing is like, in the hospitals are like working on their physical boundaries. They have to think coming out of the hospital, cross their boundaries, reach there and start having some solution there.
So many times hospital beds are occupied. You do not get a hospital bed. So like semi-critical patients, can they be managed with telemedicine?
It is. I will give you one example. Like, when we have started a pilot here in Noida, Greater Noida and Ghaziabad, there were patients, who were like got treated and surgery done at hospital, but not they are taking rest at home or recovering at home. And then whenever there is a question of going to a hospital back for a consultation, it becomes a pain for them. It costs a lot. Someone has to take a leave and take him to the hospital. It is 5,000, 7,000 rupees at least. If you have a solution like this at home, or it can be given at a service cost of 500 rupees, that doctor can see the patient from home, whereas everything is there. You see Vedanta and all that, lot of people from 500 kilometers come here for get the operation and surgeries done. And there is a lot of consultation, visits required, where doctor would like to see after 6 months, 3 months, 1 year, and they have to come physically. If such solutions are there where he is getting all this data there, so it is reducing the cost for the hospital, it is reducing the cost for the people also, and it is saving time. It is going to help in that way also. Money-wise, it will save the cost as well as time.
I checked with one of the hospitals, like corporate hospital Max. It was charging 2,000 for a RMO visit. Yeah. So
See, this is what is the difference. So any doctor, if you want in NCR to come at home, it will cost minimum 2,000 to maximum 5,000 rupees. And then you have to compromise with the doctor also, because few doctors only will come. Everyone will not come. And such solutions you can, we have done a pilot, and we have given a service at 500 rupees, where the person was going with the device, like how you get the food delivered at your home, and you can select the doctor of your wish where you want to consult. You can connect the doctor, within 10 minutes consultation over, and then we come back and patient is happy. So this is, see, till the time you are able to give such solutions where both ends have some utility.
And how are you recruiting doctors and paramedical staff?
It is not like, it is, I think that is something very specific to our solution, so I think we'll discuss separately.
Thank you very much for all the panelists. It's an excellent...
Please put your hands together, ladies and gentlemen.
Thank you very
now.
much, sir. Thank you very much.
I request Ms. Samiksha Singh from IHW Council to please join us on stage for the presentation of mementos. We'll begin with Mr. Vishal Gupta. Sir, to please step forward. Kindly keep the applause going as we now thank our eminent speakers. Dr. Sanjeev Kumar, please step forward. We'll now present a token of appreciation, a token of gratitude to Dr. Sanjeev Kumar. Mr. Shailendra Sinha, please give it up for Mr. Shailendra Sinha. Can we give him a more energetic round of applause? Session moderator, Dr. M.N. Rao. Please put your hands together for Dr. Rao. I now request all esteemed panelists to please come together for a group photograph. Kindly come together for a group photograph. We once again thank our distinguished and learned speakers for sharing their valuable insights with us and sparing their valuable time for us. Thank you very much. Ladies and gentlemen, we'll now take a 30 minutes tea break. Tea is organized in the pre-function area. We request you to reassemble in this hall at 5:30 p.m. for the keynote addresses, followed by the much-awaited award ceremony. Thank you.
Can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of a billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of a billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from Quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion+ dreams. This is not just our journey. This is the rise story of a new India. Every great story begins with a spark. Ours began with a belief that storytelling can build a nation. We chose health as our mission to fuel national growth, nurture productivity, and inspire a healthier, happier Bharat. From there, we became the partner of choice for all who care about India's future. From agriculture to education, from India's tryst with GST to drones for national security, from Har Ghar Jal to corporate governance, from quality Bharat to global trade and diplomacy, whether the India-Middle East-Europe corridor or India's rise on the world stage. Teamwork and its allied concerns have always been at the forefront, writing new narratives of nation building. What began as the humble dream of two visionaries now powers the story of 1 billion-plus dreams. This is not just our journey. This is the rise story of a new India.
Ladies and gentlemen, we'll begin the session in 2 minutes from now. We request all our delegates to kindly join us inside the hall and please be seated. Kindly switch your phones to silent mode. We'll begin with few keynote addresses followed by the award ceremony. We request all our delegates, our participants to kindly come inside the seminar hall and please be seated. Welcome back, ladies and gentlemen. We'll begin with the first keynote address on building India new digital continuum of care, virtual first home ready. Please join me in welcoming our keynote speaker, Dr. Sanjeev Kumar, governing board member, NIHFW. Can you please extend a warm welcome to Dr. Sanjeev? on stage.
My PowerPoint, this is the remote. Good evening. Before I start, I congratulate and compliment Kamal Narayan and IHW Council team. And I have been part of this team almost for more than a decade now, and I enjoy interacting with the participants and contributing to formulating what IHW Council should do. Today's event is very important. I am sure all of you know, this event is a pre-summit event for Global AI Summit going to be held in India. This is the second summit, Kamal. First was held in Paris. Modi ji and Macron got together to take leadership in AI in different aspects of life, and I am very happy to be part of this event, and hopefully we'll get a lot more out of the global summit which is going to be organized soon. Am I stuck with technology? Yeah. I want to clarify 3 things. We are looking at technology, and as I said, we are looking at technology sitting in a well. हिंदी में कूप मंडूक जो बोलते हैं ना, उस तरह से हम देखते हैं. But we always need to connect with the big picture. So big picture, one aspect I want to raise is you need to look at health and disease in a continuum. And if you look at only disease, you will get overwhelmed by sick people. You don't look at health, you don't prevent disease. More and more patients will keep coming, you will keep opening more and more hospitals. This is like trying to dry the floor with all the taps in your house on. So you have to close the tap. So when you start looking at health and well-being, you will close that tap and you will invest more through technology in keeping people healthy. And IHW Council stands for health and well-being. So it's very close to the theme for which IHW Council is working. Second aspect I want to point out is we need to look at the whole population. Then only you will be able to address health and well-being. So you have 4 groups in a population. One group is those who are healthy. They don't even have risk factors. And our effort through technology should be to keep them healthy. Then there is a second group who have risk factors. Maybe both the parents are diabetic, so the child is more likely to be diabetic in later life. So this is the second group. They need to continue with healthy lifestyle and be screened more often because they are more likely to get the disease for which they are at higher risk. The third group is the people who have the disease but they are not aware. They have not been tested. Maybe they are diabetic but their blood sugar has never been tested. So unfortunately we have a large proportion of population for cancers, diabetes and other non-communicable diseases who have not been screened and we don't know. So the hospitals and healthcare services frequently organize screening camps to pick them early so that the disease does not progress. And the fourth group is the population who have the disease. And this is where most of our discussion has been on helping them with technology so that they can be taken good care. They can themselves take good care and the healthcare providers take good care of them. So that is what has been most of the discussion. But we need to step back, start looking at those who are healthy with or without risk factors and pick up those who have disease but they have not been screened. We need to look at health outcome framework. We normally look at health system framework. That is a very narrow way of looking at health. If you look at health outcome framework, Then you look at healthcare providers, all of us represent that group. And most of the people for healthcare go to private sector. Government looks at public sector, but they at times ignore how much contribution private sector is making and how to support private sector, how to mainstream private sector so that they can improve health of the population. Public system, yes, about 1/3 of the people go to public system, starting with now we call it Arogya Mandir, the health and wellness center, primary health centers, community health centers, and upwards. Then you need to look at family and community. If I were given choice, I would probably put family and community before health system. This is where health is generated. This is where disease starts. This is where decisions are taken whether to go to hospital or not go to hospital, take some desi nuskha or go to Ayurveda or whatever. The decision is taken here. And we need to empower the family and the individuals to take those decisions early with various devices, technology devices we have. Then they will be picked up early. You know, the third group we looked at those who have the disease but don't know. If you empower the family, those with the disease will be picked up early, and those who are healthy will be facilitated to remain healthy. And the last block is other sectors. And I often teach health in all policies, and I ask this question, I'll ask that question to you as well. What do you think is the contribution of health sector, public, private, right up to grassroots level to quarterly level hospital? What is the contribution of health system to health? Any guesses? And I think one of the youngsters should be able to answer. We have been in the system, so we get so much bogged into health system, we don't look beyond. The figure is only 10 to 20% of health is contributed by health system put together. 80 to 90% of health come from other sectors. Water, sanitation. We are all struggling with air pollution. Doesn't come from health, comes from outside. Agriculture, and you have these fast foods which have become available. What do they call it? Processed foods which are very unhealthy to eat. They all come from other sectors. So we have to have one whole of government approach. All the ministries need to look at health. We were talking about health policy in the last panel discussion. We just don't need health policy, we need health in every policy. Education should have health, industry should have health. Automobile industry, for example, if they don't have safe cars, you will have more accidents and more people dying or getting injured. Road, highways, they are prone to accidents, and accidents will take place. You will keep opening more and more trauma centers, but the stream of accident injuries will keep flowing into the hospital. So we need to look at other sectors at the same time and see what they can do when we are applying technology. This is the approach we need to adopt. Empower individuals and families to take decision on remaining healthy, to take decision on when they become sick, go to hospital immediately, so that the disease hasn't progressed to a stage where it can maybe not treated, or if treated, it has sequelae. If it is picked up early, for example, cancer, if it is picked up as carcinoma in situ, it has not spread, it's a small lesion somewhere, which has not become cancer, it can be cured. Early cancer, it's confined to one small organ, can be removed and patient can be cured. So it has implications for hospital outcomes as well if you empower families, and this is what this picture gives you a message. Role of family, I talked about it briefly. In health, we said 100% of health comes in the family. If I go to a hospital, maybe a cardiologist, And I tell him, I am healthy, tell me what to do. He says, I have a long queue of patients waiting, get out of my clinic. He has no time because he is used to seeing the sick. So health is always at home. Yes, the specialist, maybe through technology, can give the right messages to the people so that they remain healthy, and then pick up the disease, and role in diseases again starts at family and ends at family. You go to hospital, unless you go to heaven, you come back home. Follow-up is always done at home, and the family plays a very important role. This is an example of life-saving interventions. Most of my life I spent in UNICEF, going around the world, 30 plus countries. There are many interventions which are done exclusively at home, and they save lives of mothers and children. And then there are interventions which decisions are taken at home, but hospitals provide, or outreach services provide care, for example, immunization. So we need to keep in mind many of the life-saving interventions can be done exclusively in the family. And we need to give that importance. And when we talk of technology applications, think of apps which empower the family to take the right decision and decisions in time. So much is available already. Are we maximizing use of those? We have remote monitoring system, blood pressure monitors, glucose monitors, wearable devices. You have a long list. You can do it at home, and you can empower the families by connecting through technology to the hospital or healthcare provider who takes immediate step. Give you an example. I am standing here talking to you. I have a wearable monitor, and I get a call from a hospital, Dr. Sanjeev Kumar, you are going to have a myocardial infarction. I pick up something. Stay where you are, don't exert. Ambulance is on the way. The ambulance picks me up and takes me to the hospital for intensive cardiac care unit. So that is the possibility you have if you integrate technology at the hospital with technology at home. Virtual consultations, we talked about it. Electronic health records also was discussed. Assistive technology. We are living around 71 plus years now. And when India became independent, how much was our average lifespan? 32 years, more than doubled. And is increasing 4 months every year. So we are going to have more and more people in my age group. And we need to make sure that assistive technology is available for people like me and elderly, for safety, for independence. In the morning, we talked about pills. I have a box of pills for my mother. She was taking out pills and the whole box fell down. All the tablets got mixed up. And she came to me, Sanjeev, I spilled my medicines. I went back and put them on the... If you have a smart pill, it automatically reminds you which medicine you have to take at which particular time. Fall detection, mobility aids, etc. Artificial intelligence and predictive analysis, Internet of Things, smart home, integration. You have many things which are available today, and we need to integrate them and couple them with the specialist sitting in hospital so that you can take care of the people when they are at home. Virtual hospitals. I gave you example of somebody getting heart attack, and the hospital picks it up and takes me to hospital before any complication starts. That is how hospitals are going to be. You don't need to go to hospital for blood pressure checkup or blood sugar checkup. It is done through a wearable device, and the doctor monitors it and takes action and gives you advice accordingly without your walking into the hospital. Challenges, yes. Digital literacy gaps we talked about, but there is a good news. Paytm, roadside vendor who is illiterate is using Paytm. So we have technology which has gone to scale very fast even among the illiterate. So don't start with that challenge and see how it can be easily adopted by a person who is illiterate or semi-literate. Connectivity limitation. We need fast internet connection if we want to go to scale with the technology in health facilities and also at home. Data privacy and interoperability. We have been hearing about so many apps. Can they be integrated into the whole system of healthcare? I have my doubts. So it has to be interoperability, which the government has to ensure that everybody has access to a system which they can use and is connected with all other applications. Need for equitable access. Disparity, inequity is rampant in healthcare. Those who need it the most are the ones who are least likely to get it. We need to address that, and I am sure technology is going to help us in a big way. Thank you.
Do we have any questions for Dr. Sanjeev? I now request Mr. Omar to please join us on stage for the presentation of a token of respect, a token of appreciation. Sir, please take the center stage. Can we all together help thank Dr. Sanjeev Kumar for sharing his valuable insights with us? Thank you very much. Yes, sir, it's a sign of a very good session if the audience has no questions. Ladies and gentlemen, our upcoming session discusses implementation level challenges and opportunities of integrating AI in India's public health programs. It focuses on how leadership, policy direction, interoperability standards, and health system readiness can accelerate adoption of AI for scalable public health transformation. And this session will be taken by Dr. Sunil K. Khidrpal, Deputy Director General, IHW. Dr. Khidrpal is a distinguished healthcare leader with extensive experience in hospital administration, health system strengthening, and quality improvement across India. As Deputy Director General of IHW, he has been instrumental in guiding hospitals towards safer, more efficient, and patient-centric care models. Can we together please welcome Dr. Sunil K. Khidrpal on stage with an energetic round of applause.
Thank you. Good evening to all. Good evening. It's my proud privilege to be here at this event. I know you must have had a long day today, and we are at the fag end of the day. And some of the awardees must be anxiously waiting for the awards and the dinner. So, my talk will not be, to just give you, a lot of gyan and, you all are, very knowledgeable, accomplished people. Most of you are there. But, technology, where it was, where it is now, and where it will take us tomorrow is something we need to discuss. And my topic, I would be focusing more on the policy, that is not only policy, from policy to practice, and enabling AI-driven transformation in India's public and private, because I represent the private healthcare institutions. So I will talk about the public and private health ecosystem. Just to give you an overview of IHPI, that is the Association of Healthcare Providers India. We are a not-for-profit organization, and we represent majority of private healthcare institutions in the country. That is, we have about 20,000 member hospitals across the country. And We have created 20 state chapters, uh, practically covering entire India. So for example, Northeast, we have 2 chapters, Northeast 1 and Northeast 2, covering the entire eight states of the Northeast. We have Maharashtra and Goa, 1 chapter, UP and UK, 1 chapter. So practically we are covering the entire country, and each state chapter has got an empowered, active and functional executive committee represented by a president, vice president, secretary and executive committee members. Health is a state subject. So our main forte is to do advocacy, policy advocacy with the government, with the regulators and with the stakeholders. For example, stakeholders are many. It is including the insurers. Recently, you might have seen in the newspapers a lot of media hype about AHPI and, with the insurance companies. Of course, this is that's how, we engage and we help our members. And our main objective is to achieve universal health coverage that is accessible, affordable and acceptable. Acceptable, that means quality care for every citizen of the country. And we have come a long way. The association was founded by very visionary founders, including Dr. Devi Shetty, Dr. Girdhar Gyani, who was the Secretary General Quality Council of India, and who was the one who brought NABH, specific healthcare standards in India. So I am just next to him, and we work very closely. This second IHW Smart Hospitals and Diagnostics Summit 2025, the focus today is using digital health and AI to transform care. So it is not just timely. This event I'm talking of, Kamalji is sitting here. This is not only timely, but essential for the future of India's healthcare system. Very important. My message is very simple. I'm not going to, as I mentioned in the beginning, not going to complicate the things or give a lot of gyan. That India has strong policies, clear intent, but the real journey is taking these policies into everyday practice across public and private hospitals, diagnostics, and community care. So the foundation is very strong. We have a very strong foundation. Our nation has a strong foundation. We now need scaled adoption. That's important. So India has created one of the world's strongest digital health foundations. We all know about Ayushman Bharat Digital Mission and digital public health infrastructure. DPDP Act, of course, 2023, and of course the draft rules I think recently passed, and growing AI innovation across various domains, various specialties, radiology, pathology, hospital operations, and public health. So what is the challenge which is there in front of us? It is not the vision. The challenge is not, it is the execution. That's very important. So we must make digital health and AI simple to adopt, easy to scale, and safe to use. I will repeat: simple to adopt, easy to scale, and safe to use across every level of care. Every level of care, from primary, tertiary, secondary, tertiary, quaternary. Because healthcare, if you see the spectrum of healthcare, if you see it's preventive, promotive, curative, rehabilitative, and palliative care. So you see the use of digital health in all across the domains. So most importantly, I will touch upon the leadership when we are talking of policies. So policies cannot be without the leadership and governance. The real drivers of adoption, AI adoption, are the leaders and the governance. So policies alone cannot transform healthcare. They are there in the paper. Very good, nice to see the, you have the blueprints, you have the policies, all documents are there. They are there, but the idea is that leadership does every institution, public or private, needs, as I mentioned, that a clear digital AI governance framework, strong oversight for ethics, safety, and quality. You know, this digital health or AI should be the boardroom discussion in every hospital. It should be in the boardroom. It should be every day's discussion in the boardroom. I think, and it has to be at the strategic level. You cannot just go to the level, down. It has to be there. The top commitment has to be from the top, then only it trickles down to all the levels of employees. So the standard operating procedures for data for AI tools and clinical work overflows. So this is exactly where our association, AHPI, plays a critical role. Our role, I will just mention in brief, supporting the hospitals in digital healthcare assessment. We are tying up with the HIMSS, the maturity level assessment, building governance frameworks for quality, safety, and digital adoption. This is very important. The most important another part is the capacity building. See, digital literacy, at every level, training, leadership development. You have to create champions. You have to create champions in the hospital. And creating consensus guidelines. It's not so simple, these things, they look so good, and we need to use model policies for responsible AI use, responsible and ethical AI use. So, acting as a bridge between, we are actually the catalyst. We are the catalyst. We act as a bridge between the policymakers, industry, and care providers. And ensuring that the voice of small, medium, large, because we represent all sizes of hospitals across the country, Tier 1, Tier 2, Tier 3 cities. So which form India's backbone, of course. And AHPI, we focus on leadership, we focus on governance, patient safety, of course, is a main. We make it a natural enabler of AI's transformation journey. Now, what is the challenge with ABDM? The interoperability, making it real, is the biggest challenge. Now, ABDM also should move away from daily practice, from policy to daily practice. Actually, it should move from policy to daily practice. And one thing I must say that ABDM 2.0, now AHPI is included in the mission steering group. That is a committee which is part of ABDM. We have been included. Among one or two association, private association only has been included in this committee, mission steering group for ABDM 2. That is the next level, ABDM 2. So we are part of the committee. We work very actively with NHA. Then for all these to happen, what we need, what does India need? So we need standardized digital workflows, and onboarding is very important, which is always a challenge. It has to be simplified. Onboarding of diagnostics, small hospitals and clinics. I'm also talking of clinics. And easy consent and secure data sharing. These things should be simplified if you want to make the onboarding to ABDM, augment, if you want more and more adoption, you need to simplify everything. From digital workflow should be standardized, and also consent should be, made easier, secure data sharing, smooth integration between HIS, LIS, RIS, lab, radiology, and public health systems. So that's very important. When the data flows smoothly and safely, AI becomes far more powerful and meaningful. It's all data driven. AI is how you train, how you feed, how you have to master first. Then don't let the AI, dominate you. But then it is, AI is a bigger enabler, I know that. But we have to be, far more powerful and meaningful. That's very important. Now, the fourth thing which I would like to mention is the workforce, the human resource. It should be a meaningful workforce. Readiness of the workforce is important. this is actually, they are the biggest enabler of AI, right? And the success of digital health depends upon people, not just technology. Technology is there, but it is the people who drive technology, right? So people are important. I would say people first. So we must equip doctors, nurses, technicians, administrators, frontline workers, all levels of employee to use simple, first is, mobile first solutions, I should say. Then they should also know how to manage their digital tools confidently. So digital literacy at the local level, at the, that's important. Then you can scale up. And this is another area where we actually pitch in. AHPI's national training ecosystem is critical. We have actually tied up with quite a foundation, and we have conducted the Digital Health Master Class, which is a very basic module, just for EMR and HMIS. And we have conducted about, we have trained about 450 hospitals. And we have conducted training for about 450 leaders, healthcare leaders, and about, say, more than 100 hospitals. And across the 6 states, we have conducted this Digital Health Master Class. This is something which I would like to highlight. No, AI will not replace the professionals, whatever you may say, but AI will never replace. But professionals who can work with AI will, of course, lead the future. They will lead the future. Now, another thing is the responsible and ethical AI, as I was mentioning, that when you talk of AI, it should be responsible and ethical. And so what is important is trust. The trust is the foundation of healthcare. The relationship between a doctor and a patient is based on trust. The relationship between the healthcare professionals and technology is also based on trust. So, and trust in AI depends entirely on how we handle the data. How we handle, as I already mentioned. Now, DPDP Act, we all know, 2023 rules, they are giving us a very strong legal foundation for data protection and consent. Patient rights are important. Patient rights and patient rights, privacy, confidentiality, right to have access to the medical own records. See, patient is the owner of the records, his health records. The hospitals are, and the other, they are only the custodians actually. So, accountability of hospitals, vendors' role is very important. Most of you are, vendors sitting here, and AI developers. Accountability is important. Your role is very important, but accountability at all levels is important. And there's penalty for misuse or breach. This also is addressed in DPDP Act. So for the healthcare sector, this means that AI tools must use data ethically and legally, and hospitals must ensure valid consent, secure storage, and clear communication. That's very important. These algorithms which we are using, they must be, explainable and auditable and bias-free. Because, we also face a lot of issues with, algorithm biasness with AI. Vendors must comply with privacy by design principles. So this is very important, privacy by design principles. Even the doctors or the healthcare professionals, they are not very, very confident, not very happy. They are scared actually of the breach of the data security. So I think that's very important to give them trust and confidence. So DPDP is not a barrier, I should say. It is an enabler of safe, trusted digital health. It gives patients confidence. It gives us confidence. So we should respect AI. And lastly, I would like to say that public-private partnership, collaboration, is the main engine of growth. If you really want to grow in your digital health ecosystem, all of us, all the stakeholders should come together, right? And because in India, if you see, 70% of the healthcare is delivered by the private health sector. And 80% of diagnostic is by private sector. Just imagine. Oh, the public sector cannot do, cannot provide, they don't have that bandwidth or infrastructure to cater to the healthcare needs of the citizens of the country. So the role of private sector is equally important, and it has to be, in synergy, in collaboration. But public health programs also, if you see, they depend on the private partners at every stage. You see any program, National TB Elimination Program, vaccination program, without private, you cannot meet the, needs. So to scale AI, we must actually, I should say, really deepen the collaboration. So joint innovation, test beds, I should say, shared data standards, affordable Indian AI solutions. Affordability is equally important, because if you see the small hospital, when I talk to our member hospital at 50-bedded hospital, they say, bahut mehenga hai solution, bada mushkil hai. I mean, that willingness, it's not coming. So that acceptance is not there. So that's what we need to educate them. We need to offer them some very affordable solution. We need to educate them, actually. So that's important. And partnership between government, startups, hospitals, and associations like us. So PPP models for telemedicine, NCT care, emergency response. Telemedicine, eSanjeevani is an amazing platform. I think this telemedicine was legalized during COVID pandemic on, I think, 25th March, 2020, yeah. So that was the time when, after that it scaled up and everybody started becoming virtual. We were sitting in the same hospital. I was heading Rajiv Gandhi Cancer Institute. I was the CEO there. Internal meeting we were doing virtual, sitting in the different rooms. I was admitted with COVID pandemic, very bad condition. Doctors was visiting me virtually within the hospital. People were scared to come and see me, to meet me. Nurses, they come once or twice at the most, So that was a time, very bad time we all faced. But then telemedicine, I was talking that eSanjeevani platform, I think, I'm not very sure, but it must be 42 crore plus consultations has happened with eSanjeevani today. And most of the beneficiaries are the women. I should say, I think it's 54, 55%. Beneficiaries of this telehealth are women. When you see, I am also an ABH assessor. I am an NQAS assessor. I even go to, so I can see the both sides of the coin. And when I visit some primary health center, Ayushman Arogya Mandir, there are about 1,70,000 Ayushman Arogya Mandir. There are so many apps they are using, ASHA workers, ANMs, CHO, who is just a GNM, a nurse. Amazing. They are the technology, use of the telehealth they are using. And mostly it is, consultation is for the maternal and child health. So most of the beneficiaries are the women. So telehealth is not between the doctor and the patient. It is between the doctor and the doctor also, right? A primary care physician needing a specialist consultation has to consult a specialist. So it's teleconsultation is between a doctor and a doctor also, not only between the patient and the doctor. So when we work together, we join hands, we can actually accelerate transformation. We have been talking about transformation. Digital transformation is a buzzword now. But we all need to come together on a single common platform to join hands to take it forward. So where AI can drive immediate practical impact, these are certain areas, because it of course, reduce the workload. There is early detection. In diagnostics especially, I'm talking of hospital operations, there's triaging. See, patients visit the hospital, right from the appointment to going at the front office to OPD to diagnostics to admission, IP to discharge, from entry to exit, from all touch points in the hospital, you need technology. All touch points, wherever the patient is in the hospital. He is in the physiotherapy, he is in the lab, he is in OPD, he is in ICU, he is in dialysis unit, he is in, wherever the patient is. OT, there is all touch points you need diagnostic. So clinical decision support is very important. So healthcare is actually driven by the outcome. The definition of quality in healthcare is when we say when the patient achieves the desired outcome. Ultimately, what matters is the outcome. Why should I go to a hospital? मैं बीमार होके जाऊँगा, ठीक होके आऊँगा. Outcome अच्छा होना चाहिए. Outcome के लिए you need technology. You need to improve your operational efficiency. You need to improve outcome. Then you improve patient satisfaction. You increase patient satisfaction. आजकल patient satisfaction नहीं बोलते हम patient experience, patient delight. Satisfaction तो बहुत हो गया. अभी हम इस पे जा रहे हैं, next level of that satisfaction. So public health में is very use is outbreak forecasting, risk stratification, and automated follow-up. Patient experience I already mentioned. So we should all talk of Bharat now, that AI works for Bharat, not just for metros, as I mentioned. Every citizen of this country is important for us. And it is not, we are talking of metro cities and big hospitals, the corporate hospitals. Of course, they are there to adopt technology at a much faster pace. And India is a country which, any new technology coming to the world, we are the first one to adopt. I have met Dr. Pratap Reddy. Last year, we honored him with the Healthcare Icon of the Century. In Chennai, we have our leadership summit. He could not make it personally, but I went to meet him. So he told me that, how at an age of 92, 93, he still has a vision. He still has a vision. When you talk of the vision, it's not vision never ends for a visionary person. Like Dr. Pratap Reddy, 75 hospitals he has created till date. And he was talking of, that he's going to, how technology, how his journey, he actually, he narrated his journey to me. It was amazing. And so ultimately, we should look for the low-cost solution, and it should be local language friendly. The solutions easy to adopt, minimal training required, low bandwidth compatible. So AI must reduce the digital divide, not widen it. So to summarize, to end my talk, I would say India or the Bharat has the policies. We have the talent, we have the best talent in the world. I think more than 30% of doctors in America, US are Indians. We have been holding top positions across CEO levels, across the world. We have the digital infrastructure, and through organizations like HPI, we have the national platform to scale responsible adoption. So we must focus on practical implementation. This is just to summarize what I have spoken so far. Practical implementation, workforce empowerment, protecting patient data, DPDP, collaborative innovation, safe, ethical, and lastly, inclusive AI. So if we do this well, we will help build a system that is more efficient, more accessible, more accurate, more transparent, and more humane. Last word is humane. I think that human touch we should not forget, as I told you, that the empathy and the human touch and maintaining eye-to-eye contact with the patient, feeling the pulse of the patient, keeping your hand on the shoulder of the patient, talking to the patient is a big healer. So that human touch, you may talk of technology, whole day you must have spoken of technology, but please, end of the day, it is a human touch. So the blend of human touch and technology, we will definitely achieve our goals. So last word is, the future of Indian healthcare is AI enabled, clinician led. Doctors should lead actually. They are, still, it's a very gray area. And patient-first approach, patient should be on the top of your mind always, whether he's a vendor, he's an AI developer, he's a HR person in the hospital, a sweeper in the hospital, a CEO in the hospital, and all stakeholders. I think we are all working for the patient. We are here because of the patients. We are all here today because of the patients. So patient first, patient on your top priority, and that future begins with all of us today. Thank you very much.
Mr. Omar to please join us on stage. Ladies and gentlemen, please give it up for Dr. Sunil K. Khetarpal. Thank you very much, sir, for an enlightening address. We'll now be presenting a token of gratitude, a token of respect and appreciation to Dr. Sunil K. Khetarpal. Kindly keep the applause going. Thank you very much. Thank you very much, sir. Ladies and gentlemen, it is now my honor to first introduce and then invite our guest of honor and jury chair, Ms. Sujaya Krishnan, former Joint Secretary to the Government of India, Ministry of Health and Family Welfare, for the final keynote address. Ms. Krishnan brings decades of leadership in public health policy, system strengthening and transformative program design. In this keynote, she will reflect on India's evolving health policy landscape and the pivotal role that innovation, technology and system thinking will play in advancing national health outcomes. She'll also share insights from her distinguished service at the Ministry of Health and Family Welfare and outline pathways for India's smart healthcare transformation in the coming decade. Please join me in extending a very warm welcome to our guest of honor, our jury chair, Ms. Sujaya Krishnan.
A very good evening to all of you, distinguished members of the medical fraternity and industry. I'm very happy to be here at the second edition of the Smart Hospitals and Diagnostics Summit 2025 as a keynote speaker. My sincere thanks to Mr. Kamal Narayan, CEO, for this opportunity to address this August gathering. I deem it a privilege and an honor, and I'm deeply humbled. Today's theme, transforming care through digital health and AI, I think is very opportune. I know you have had a full day of engaging discussions, deliberations, cross-learnings, and presentation of good practices, etc. I'm not here to preach to the converted, but as the occasion demands and protocol requires, I would like to share a few thoughts with you. Digital health solutions do have the potential to make healthcare more equitable. That's the point on which I would like to emphasize. Equal access to affordable and competent healthcare has the potential to improve patient outcomes by providing better quality of life, easing reliance on emergency and late-stage interventions, and reducing early deaths. Digital technologies, while playing a critical role, however, the rapidly advancing technology may also exacerbate exclusion, introduce unexpected biases, widen the digital divide, and continue to leave some populations behind. Inadequate access has several consequences for patients. Equalizing healthcare access and quality not only improves individual and population level outcomes, but also has a salutary effect on the larger economy. Good health, prompt and effective treatment allow patients to live active and productive lives. Indeed, improvement in global health has contributed to about a third of all economic growth in advanced economies over the past century. In order to sustain this growth rate, digital health solutions must be designed to reach previously excluded or unrepresented groups. Innovations can accelerate equity in digital health by aligning goals and actions to lever that prioritize diversity, equity, and inclusion. Digital tools must improve equity by increasing healthcare access, addressing unmet needs, and personalizing care for patients, and considering the historical context within communities they serve. Digital technology can narrow the equity gap in several ways, from streamlining difficult to navigate medical bureaucracy processes to eliminating travel and transportation factors from healthcare access. Access is limited by two chief constraints: affordability and availability. Healthcare treatment costs and limited insurance coverage are well-known barriers to care. For many patients, such as those in rural areas, the limited availability of providers and the costs associated with travel and time away from home are a challenge in many parts of the country. To improve diagnostic imaging, access to handheld ultrasound devices that offer an imaging solution for rural areas is an example where more expensive machines like CT or MRI scanners or even X-ray machines are cost prohibitive. Such portable diagnostic and medical devices can transform care by reducing costs and expanding the availability of diagnostic services beyond traditional healthcare settings. Social determinants of health, such as access to clean water, nutritious food, safe housing, and transportation, affects patients' ability to maintain good health and seek care where they need it. Digital innovators have an unprecedented opportunity to think more carefully about health equity and develop new solutions to entrenched healthcare problems. They must begin by considering how inequities in access limit the number of reachable patients, and by determining which dimension of health equity their solution could address, and then develop and implement digital solutions that align with the health equity goal. Digital innovations that can move the needle on health equity will improve the lives of patients, increase the efficacy of healthcare systems, and have a positive impact on the greater economy. India's healthcare landscape is undergoing a digital transformation, driven by government policies and technological advancements. With a rapidly growing population and increasing demand for quality healthcare, digital health solutions are playing a crucial role in enhancing accessibility, affordability, and efficiency. Digital healthcare infrastructure is evolving to bridge the gap between urban and rural health services, leveraging telemedicine, electronic health records, and artificial intelligence-driven diagnostics. The Government of India's policy for transforming care through digital health and AI is primarily driven by the Ayushman Bharat Digital Mission and the National Strategy, AI Strategy. These initiatives aim to create an inclusive, effective, and accessible national digital health ecosystem while leveraging AI for societal development. The World Economic Forum's article, India Can Be a Global Pathfinder in Digital Health, was released on 15 January 2024 and explores how India's digital healthcare initiative positioned the country as a leader in health technology. Key takeaways from the report are interoperability and standardization, ensuring seamless data exchange between stakeholders, public-private collaboration, encouraging partnerships for innovation and expansion, focus on affordability and accessibility, leveraging digital tools to make healthcare inclusive, global influence. India's digital health models could serve as templates for other developing countries. The article acknowledges that India's digital health strategies can contribute to global health equity, improving healthcare outcomes across diverse populations. It further acknowledges India's proactive approach to digital health, characterized by its robust digital public infrastructure and innovative private sector, which positions the nation as a global leader in digital healthcare transformation and in developing adaptable healthcare solutions. The World Economic Forum's Digital Healthcare Transformation Initiative, or the DHT initiative, acknowledges India's potential to create scalable model that can be adopted worldwide, emphasizing the importance of cross-border collaboration in addressing universal health challenges. This recognition underscores India's commitment to leveraging technology for equitable and efficient healthcare delivery, setting a benchmark for other nations to follow. Infrastructure development, policy support, and public-private collaboration is poised to emerge as a global leader in digital health. The future focus areas include AI-driven diagnostic, blockchain-based health records, and enhanced cybersecurity frameworks. The Ministry of Health and Family Welfare, Ministry of Health is leveraging artificial intelligence to drive transformative change in public health services across India. The ministry has designated AIIMS Delhi, PGIMER Chandigarh, and AIIMS Rishikesh as the centers of excellence for artificial intelligence, with an aim to promote development and use of AI-based solutions in health. The ministry has developed solutions like clinical decision support system in eSanjeevani, disease surveillance solution in IDSP, diabetic retinopathy identification solution, and the abnormal chest X-ray classifier models, besides various others that are in the early stages. In September 2024, the National Health Authority and the IIT Kanpur signed a memorandum of understanding under which a federated learning platform across a variety of machine learning model pipelines, a quality preserving database, an open benching platform for comparing and validating AI models, and a consent management system for research under ABDM would be developed by IIT Kanpur. The platform will subsequently be operated and governed by the National Health Authority, thereby unlocking the immense potential of AI for improving health outcomes. India's participation in Health AI, a global body promoting safe and ethical AI in healthcare, and collaboration between ICMR and India's AI with countries like the United Kingdom and Singapore are ensuring responsible innovation and global best practices. I'm delighted to know that this second edition of the IHW Smart Hospitals and Diagnostics Summit 2025 will be a curtain raiser and has been announced as the official pre-summit to the India AI Impact Summit 2026, a flagship initiative by the Government of India for accelerating responsible AI adoption across healthcare and allied sectors. My congratulations to IHW Council and to Mr. Kamal Narayan and his team. I had the privilege and honor of being a jury member for today's awards. I would like to take this occasion also to congratulate all the winners. May you continue to traverse the ordained path towards providing affordable, accessible, and equitable healthcare for all. Thank you.
I request Mr. Omar to please join us on stage. Can we all together thank Ms. Sajaya for her insightful address. Kindly keep the applause going, ladies and gentlemen. Thank you very much, sir, for doing the honors. Ladies and gentlemen, we now move into one of the most awaited segments of the evening, the Smart Hospitals and Diagnostic Awards 2025. These awards celebrate excellence, leadership, innovation across India's healthcare ecosystem. And before we begin the much awaited award ceremony, I'll quickly introduce the jury for the awards. Ms. Sujaya Krishnan, as we all know, that she was a jury, former Joint Secretary, Ministry of Health and Family Welfare, Dr. Jitendra Kumar, Managing Director, BIRAC, Dr. Randeep Guleria, Chairman, Institute of Internal Medicine, Dr. Jitendra Sharma, MD, Medanta Zone, Dr. Nivedita Gupta, ICMR. So they were our jury members for the award ceremony, and now we are all ready to begin. May I again invite Ms. Sujaya Krishnan, our jury and guest of honor for the award presentation, Mr. Kamal Narayan Omer, CEO, IHW Council, to kindly join us on stage for the presentation of awards. Dr. Sanjeev Kumar also to please join for the presentation of awards. Can we once again welcome our distinguished dignitaries on stage? And let the celebration begin. We'll begin with the individual leadership categories, and then we'll eventually move to the organization awards. The first category, ladies and gentlemen, is Excellence in Smart ICU CCU Management, and the award goes to Dr. Charudat Betty, Director, Critical Care, Fortis, Mumbai. Would request the awardee to kindly enter from my right and exit from my left. Please give it up for Dr. Charudat Betty, Director, Critical Care, Fortis, Mumbai. Requesting the jury to please take the center stage. If you just can move, yes. Many congratulations to Dr. Charudat Betty. Our next category is AI in Radiology Award, CT MRI X-ray Analytics, and the award goes to Dr. Mona Bhatia, Director and Head, Radiology and Imaging, Fortis Escorts Heart Institute. Dr. Bhatia is celebrated for her leadership in adopting AI-driven imaging interpretation, improving diagnostic accuracy, speed and precision across CT, MRI, X-ray modalities. So we'll receive on behalf of Dr. Mona. He's the team member of Dr. Mona, speaking on behalf of her. Congratulations, Dr. Mona. Our next award is AI-powered Virtual Health Assistant Award, and the proud awardee is Dr. Sameer Parekh, Chairman, Fortis National Mental Health Program and Adayu Mindfulness. This award recognizes Dr. Parekh's groundbreaking work in developing AI-enabled mental health support system, bringing accessible, empathetic, and technology-driven physiological care to thousands. He's also Dr. Sameer Parekh's teammate. And now we move to the organizational awards honoring hospitals, diagnostic networks, and companies that are transforming care delivery at scale. The first award in organizational category is Mobile Health Application in Gold, and the winner is Cipla Digital Health Limited for creating user-centric digital tools that simplify access to healthcare, disease management, and continuous patient engagement. Can we give Cipla a more energetic round of applause? We've been waiting for this moment since morning, so let the energy going. Can we have a more energetic round of applause throughout the award ceremony? Up next is Digital Technology for Emerging Care in Gold category, and the winner is Apollo Telehealth for leveraging digital platforms to enable timely, high-quality emergency interventions across geographies. Please give it up for Apollo Telehealth, ladies and gentlemen. Our next award is for Smart Building and Sustainable Hospital Infrastructure in Gold category, and the proud winner is Yashoda Medicity for integrating smart infrastructure, energy efficiency and sustainable architectural design into modern healthcare delivery. Let's all congratulate Yashoda Medicity with our round of applause. I think we can do a little better. Many congratulations. Few more awards to go, so let the energy going. Up next is Best Lab in Technology, Automation and Quality Excellence. And in this, the Gold Award, the Gold category, winner is Red Cliff Labs for redefining lab operations through AI, robotic automation and high precision quality management systems. Please give it up for Red Cliff Labs. We also have an award for the one who will applaud the loudest, and will announce it towards the end of the ceremony. So keep applauding, ladies and gentlemen. It's a moment of great pride and honor for the ones who are on stage. It feels great, when you are received with such an energetic round of applause. Congratulations to Redcliffe. Up next is Excellence in Molecular and Genomic Diagnostics in Gold category, and the winner is Agilis Diagnostics. Please give it up for Agilis for pioneering high accuracy genomic and molecular diagnostics that support early detection and personalized treatment. Our next award is Best Integrated Smart Emergency Services in Gold category, and the winner is Sharda Care Health City. Please give it up for Sharda Care for establishing an integrated technology-driven emergency network ensuring rapid, coordinated and life-saving response. We now thank Dr. Sanjeev for joining us. Thank you very much, sir, for joining with me, occupy the front row. And we now invite Dr. Ashish Singhal to please join us for the presentation of the rest of the awards. Dr. Ashish Singhal, Senior Robotic Joint Replacement and Orthopedic Surgeon, Paras Health, Udaipur. Our next award is for Excellence in Healthcare Cybersecurity Infrastructure in Gold category, and the winner is Intensity Global for exceptional commitment to digital safety, protecting patient data, clinical systems and hospital networks with world-class cybersecurity solutions. Please give it up for Intensity Global. Up next is Digital Solutions for Medical Skilling in Silver category, and the winner is MedLearn for building powerful digital learning ecosystems that upgrade hospital workforce competencies at scale. Many congratulations. Our next award is for Digital Solution Public Awareness Campaign in Silver category, and the winner is Cipla Limited, the Uncommon Cold, for an impactful digital health campaign that successfully educated communities on respiratory health using engaging, high-reach communication. Now, please put your hands together for Cipla Limited, the Uncommon Cold. The next award is for Smart Hospital of the Year, Urban, Large and Mid-Size in Silver category, and the winner is Yashoda Medicity for its technologically enabled patient-first hospital systems and measurable clinical excellence. Yashoda Medicity coming once again on stage. They deserve a double congratulations, ladies and gentlemen. Up next is Electronic Health Record Solution in Silver category, and the award goes to Tattva Care for delivering seamless EHR platform that strengthen continuity of care, data accuracy and clinical decision support. Let's together congratulate Tattva Care. Up next is Digital Solution for Rural Healthcare in Silver category, and the award goes to Apollo Telehealth for its scalable digital health interventions that bring quality care to underserved rural regions. Please give it up for Apollo Telehealth. Congratulations. Our next award is for Health IT Provider of the Year in Silver category, and the winner is Ingram Micro for enabling hospitals with robust IT infrastructure, cloud solutions and secure digital transformation frameworks. Are we all congratulating Ingram Micro? The organizers have announced free one-night stay at the Crown Plaza for the one who will applaud the loudest. So I think it's a good motivation. We can do a little better. Up next is Most Human-Centric Smart Hospital in Silver category, and the winner is SUT Patom Super Speciality Hospital for combining technology with empathy, creating patient journeys rooted in dignity, safety and human touch. They couldn't join us and they've been recognized in the morning. Up next is AI in Radiology Award CT MRI X-ray Analytics in Silver category, and the winner is City X-ray and Scan Clinic for leveraging AI innovations to improve diagnostic precision, reporting efficiency and radiology turnaround times. You know, it's a healthcare seminar, so when we applaud, so there's a lot of blood circulation that happens. A lot of glow comes on our faces, so we are doing good to ourselves as well. Many congratulations to our golden awardees who are coming on stage. Up next is Diagnostic Brand with Best Adaptation of Digital Health Technology in Bronze category, and the winner is U4 Rad for embracing digital transformation to enhance diagnostic accuracy, accessibility and patient experience. give it up for U4 Brad. Finally, keep the applause going. The next award is Digital Health Solution for Women and Childcare in Bronze category. And the winner is Social Action Foundation for developing impactful digital solutions that strengthen maternal and child health outcomes. Please put your hands together for Social Action Foundation. It's a very good initiative, ladies and gentlemen. Let's support them with our generous applause. Please give it up for Social Action Foundation. Many congratulations. The second last award is Health IT Provider of the Year in Bronze category. And the winner is Suvarna Technosoft for providing reliable, future-ready health IT systems that support hospital efficiency and digital integration. Please give it up for Suvarna Technosoft. The last award this evening is for Smart Hospital of the Year, Urban, Large and Mid-Size in Gold category. And the winner is Fortis Memorial Research Institute, Gurgaon, for building a future-ready hospital ecosystem with advanced automation, clinical intelligence, smart ICUs and seamless patient navigation. Heartiest congratulations to all the winners, and now we request all the golden awardees to kindly join us on stage with their trophies for a group photograph with our distinguished dignitaries on stage. Kindly bring your trophies. We request all the golden awardees to kindly join our distinguished dignitaries on stage for a group photograph. All the awardees, yes. All the awardees to kindly join. Let's make this moment memorable with a group photograph. We also request Ms. Nikki Gupta to also join us, co-founder IHW Council, to please join us for the group photograph. Let this memory be etched for years to come with the group photograph. Please bring along your trophies. Can come together a little bit. The shorter ones can come in the front and the taller ones can go at the back. The way we had our group photographs in our school. Some of you can also come off stage. Please come together. Few of you can go off stage. Kindly come closer. Can we have bright smile on all your faces? It's our mandate for the group photograph. And a victory sign will even make it better. So a bright smile and a victory sign will make this photograph even better. Please come closer. again, many congratulations to all the winners of Smart Hospitals Diagnostic Awards 2025. Thank you very much. Once again, many congratulations. Ladies and gentlemen, with this we conclude the Smart Hospitals and Diagnostic Summit and Awards 2025. We thank you all for your participation and support, and we now request you to kindly join us for dinner. Thank you very much, and we wish you a great evening ahead.
Thank you everyone. Congratulations all the winners. I'd like to take this brief moment to thank all the team of IHW Council and all the members of IHW Council who have been putting their efforts to put this event together. I'll request all the colleagues to come on stage once, so you may like to clap for them as well. Samiksha, Vidyani, Ranjit, Saurabh, Babul on the console. So a lot of creative work which you saw during the day. Nikki, please join us. And also I would request the team of Teamwork, which is here with a publicity partner, as well as they are a very critical support to organize this program. So all the members of Teamwork can also join us on the stage for a group photograph. And a big round of applause from all of you for these people who were working behind the scene to make this event happen. Thank you so much. Come on guys, Predna.